morning, Holford Health Centre. Sally speaking.
But for over a year now, the batters have forced the doctors to hospitals for x-rays. There's got to be something wrong. It can't just be nothing.
I don't know what it is. I seem to be waking up on a morning as if I'm drugged.
I've noticed this morning her nose was bleeding. You can see.
Terrible snoring, he can keep you up at night.
Does he actually stop breathing in his sleep?
Oh, yes, he has stopped.
When I get really anxious and I start cleaning.
Right.
So I was up to about 3 this morning cleaning.
Gosh.
Hello, Spider.
Hello, you okay?
You had a happy day already, have we?
Oh, yeah, exactly. It's always a happy day.
I thought that was all Disney stuff.
Fairy tale.
Okay, hello there. Do come in.
Thank you.
All right, you're looking a bit uncomfortable there?
Yeah.
Come and have a seat.
I had a gentleman go inside of the car on Friday, so we went up to A&E.
Okay.
And they were like, yeah, just keep an eye on it.
Yeah.
And if no better, go back to doctors. And it's not, I just want something to put my head up, if that makes sense.
Mm-hmm. Yeah.
I get a shooting pain, sometimes just going across, but also across my back, about there.
Mm-hmm.
And it's like, I just want some relief, really.
Okay. So were you driving?
I was driving. There was a car parked across bays that way, and we were driving that way. We almost got past him, and he just didn't see us.
Oh, I see. You were going that way and he pulled out
banged.
into you?
Yeah.
So on the passenger
Yeah.
side? OK.
Yeah.
What sort of speed was it?
Maybe going 10 at a push.
And at the time, did you think you'd been injured?
It was a bit of shock. I got out of the car and it was like, did you not see me? And he was like, no, I didn't, love. Went to Sainsbury's and I thought, oh, my neck started to smart a bit.
Yeah, OK.
So went up to A&E.
OK, you're wearing a seatbelt.
Yeah,
You had a neck
always.
restraint on.
Well, the headrest is there, but I'm small, so it's sort of...
They're
I'm in
quite
the space.
adjustable, you know.
I know, but I'm in that... It's not quite the bottom, but you know what I mean, don't you, Teak?
She needs like a half rung in between.
Yeah, and then...
I see.
Yeah, so it's that, do I need a booster seat? Don't I need a booster seat? It's one of those sort of things.
All right, OK. OK, just swing around your chest like that. I just want to check your arms and your hands first of all, actually. Do you just show me your hands like that?
Yeah.
OK, don't let me push them together.
I've got arthritis now.
OK.
Yeah.
Squeeze my finger tight as you can. Down. Don't let me lift your hand up. Sorry about that. All right.
Yeah.
How are things going?
Oh, dear. Well, during winter, when it's really cold, my fingers tend to be really, really pale. But lately, if it even rains and it's a bit chilly, it tends to be numb. Yeah.
Do you get change of colour with it when it does that?
Yes. It
It goes
so
white.
Really,
Does it go
really
blue
white.
and
No,
purple
it's
later?
just white.
Just white.
And
And just on the
sometimes-
tips of all your fingers,
Yes.
because they feel cool to me now.
Yeah, and
it's
I'm
painful.
always yeah, it's really painful.
And it's worse when it's cold and rainy and
That is
winter.
It. Yes. I don't know what's wrong with me.
Do you know what that you don't know? Because I'm sure that the diagnosis is Raynaud's syndrome.
Oh.
Have you heard of that before?
No.
Well, it's a common problem affecting around 5% of women. But it's the spasm of the blood vessels as they supply the tips of your fingers, and it's set off by the cold. And it makes them go white, and it makes them be painful, and it's basically everything that you're describing.
Yes, it does happen. I was like, it's something wrong
Shall I
with
write-
me.
I'm going to write down
and I can have a read about it myself.
Go and have a read, because
Yeah.
you'll see. And there isn't a magic fix, though you can try gloves and keeping your hands warm and things like that, and you can try some medication for it if it gets really bad. Go and have a read about the treatment.
Okay, I will surely do. Oh, dear.
Occasionally, it can be linked to other more generalised illnesses. So if you read up on there, it will tell you what those are. They're much rarer, but they would need another blood test if you had some of these other you know, kind of symptoms or problems, swallowing problems, generalised joint pain.
Okay.
But if it's not doing that and it's just isolated Raynaud's, then it doesn't need us to do lots of other tests at this
I'll
stage.
read
Unless it
about
gets
it.
really bad, in which case we'll see you again.
Okay, I'll read about it
And then let me know.
I shall let you know. Oh, God. I think you have
Fingers
to see me
crossed,
all the
Janet.
time. I hope you're not tired of seeing me.
No, it's absolutely
Do
fine.
you mind if I
don't
check my weight on the...
No, that's fine.
You
Just
sure?
you'll need to tap on it just to turn the scales on.
You know, after I left here, I've been really working hard.
Great. Well, fingers crossed then.
Fingers crossed. So hopefully, let's make 72.
How's that?
That's good because that time it's 72.6. It was 74 the last time I came.
Well, there you go.
So I think it's paid off.
Well, yeah,
Thank you
well,
very much,
done.
Dr.
Nice to
Penny.
see you. Bye.
Okay, just turn your head slightly that way.
Yeah.
That's hurting. You've got to say when it hurts. Mum.
I'm sorry.
Yeah, say out, because I can't see you very well.
Sorry.
Okay, so if I turn it that way.
That's a bit sore there.
Okay, if I turn it the other way.
Sore there.
Okay, but it feels like it's moving reasonably.
Yeah.
Actually, you can hold your head in neutral. It's just it's more comfortable to move it that way.
I just need something like a constant pillow would be lovely, but I can't seem to find.
Have you tried making your own?
I mean, I put the rabbit that I have in my bag underneath, and that's quite nice because
Yeah,
it's
it
quite
Feels
squidgy.
lovely.
Yeah, that looks like good medical device, doesn't it?
Yeah, I thought so. It's just I just need something soft.
Okay. Just to say what's happened here, I mean, this is a common thing. If people are in a road traffic accident, often you get a little bit of jarring in the muscles, and it can be surprisingly uncomfortable for a day or so.
That's what they said, yeah.
Maybe even a week or so sometimes, but I don't think it's going to be that long with you. And I don't think there's anything serious damaged here, and I think everything's going to come right. It's sometimes helpful to have an anti-inflammatory gel to rub into the muscles.
I've still got some from before. Am I allowed to use it?
Yes, certainly use that 3 or 4 times a day, actually.
Okay.
That'd be fine. We can't prescribe you a neck collar, and actually we really wouldn't want to.
As stupid as it sounds, I do have a collection of teddy bears. I might just try one of those.
Okay, teddy bear therapy.
Yeah,
that'd be good.
There you go.
Okay, and then I'll give you a sheet with some neck exercises.
Lovely, thank you.
All right?
Yeah, maybe you
Give me
could
2
sell
seconds.
them in a little sort of shop on the side.
Oh, yeah, we could do that. Everyone needs a teddy bear or two.
You'd buy them all.
I would buy them all.
There we go. Jolly good.
Thank you. Thank you very much.
Okay, and I hope the car gets better soon.
Oh, the car's getting taken away.
Monday.
It's going to be fixed.
Thank
Jolly good.
you.
Bye-bye.
Bye.
Hello, I'm liking the wheels.
Yeah.
I tell you what, can I swap? This is killing me, this.
Christopher Collins, please.
Sorry, I couldn't do much. I've been doing it all night, this.
And then you struggled, not to worry, coming in.
So when you've got to go, you can't go. When you don't want to go, you go a lot.
Have a seat.
I've been terrible all night, I tell you.
Oh, dear. So tell me what's been happening.
Basically, it started in the afternoon, about 3. I was weeing. I couldn't control my urine, and throughout the night from the evenings, it was doing it all the time. Like, you know.
Right, OK.
I weed this morning at about 9 and a lot came out.
OK.
I actually weed into a bucket in my room because I couldn't make it to the toilet.
Oh, dear. Should we have a little listen? Where does this go? Yeah, fantastic.
Take nice deep breaths with the open mouth.
Can you say 99 for me?
99.
And again?
99.
And again?
99.
Nice deep breaths. Oh, there's some serious static going on.
Nice. Morning. You have to sit on this one because it's you that's here.
Hi.
She woke up this morning and her heart was racing, like I did like her pulse and things. And then she was led in bed. She was literally just led in my bed and she was like that. She was breathing really fast.
She was kind of panting.
Yeah, as if she'd just been running. And then had a really bad cough yesterday, didn't you?
Yeah.
Stay here because he's got to see you.
So yesterday she was coughing.
Coughing a lot. She's normally quite happy, walking around and running around. And then all of a sudden, she'll just want to lay down for half an hour.
She had any temperatures at all?
Although she didn't have a temperature, she was sweating, but she was, like, not hot to touch. So I was like, that's not normal.
And was that at the same time as she was breathing more quickly? All right, Karina?
I'm 35.
Do you think you could come and sit on this chair? What a start. Right, have you seen one of these before? This is called the stethoscope.
It's magic.
I'm going to listen to your heart to start with, which is there. And it is beating.
Shh. He's got to listen to Sissy.
And it's beating nice and regularly at a normal speed at the moment.
Okay.
Now I'm going to have a listen at the back.
It's going now.
So both our heart and our lungs sound completely normal.
Breathe for it.
Let's see what your temperature is now.
Freeze.
So temperature's 36.6.
That's good.
Which is good.
That's what we want.
Yeah. Right, now, I want to have a look in your mouth. So I need you to open really wide for me. Can you open a bit wider?
Open as wide as you can.
Don't puke.
Does it feel sore at all in there?
Does it hurt?
Shh, let her listen to the doctor.
Okay. Looks a little bit red.
Okay.
And I can feel some little glands enlarged in her neck. OK, we're all finished there. You can go back to playing if you'd like. So I think the first thing to say is I don't think there's anything too serious going on. I think probably she is brewing an infection, which explains a lot of the symptoms, and it's here upwards rather than there downwards. Throat looks a bit red. Her breathing going a bit quicker, coinciding with perhaps having a temperature. I think those two things often go hand in hand. Fast breathing or panting, if that's on a sustained basis, if it's not getting better quite quickly, is definitely one of those things that we do take quite seriously because it can be a sign of more serious infection.
Yeah. Really?
OK.
We're finished now.
Wait.
Take care, guys.
We can go now. Say bye. Say thank you. 3, 2.
Am I getting better at cartwheels?
Yeah, please stop. Big pull. Oh. Thank you. Be back for a broken leg
Yeah, no, I was
later.
just thinking that. See you soon, bye.
Good girl.
If you pop up on the bed, can I have a little feel of your tummy? And are you drinking okay?
Yeah.
Yeah. Okay. Okay, can I have a little feel of your tummy?
Yeah.
Yeah.
Could you do the bathroom?
Are you not able to? There we go. Okay. Have you got any pain there at the moment?
No.
No. I'll just have a little gentle feel around, okay?
Okay.
That's fine. You can pop your stuff back on. Do you want me to do the button again?
Please, yeah.
There we go. So you just do your zip, okay? And get up when you're ready. Okay, so this is showing a lot of white cells, some blood and some protein, so that is probably a urine infection. So it's really important to drink as much fluid as you can. Take paracetamol if you get any pains or fevers.
Okay.
Is that okay?
Yeah.
Antibiotics, 1 twice a day for a week.
Okay.
We're treating it as a urine infection, but it's a little bit more unusual to have a urine infection in men, so that's where it's really important for you to come back next week and check that everything's resolved, all right? In fact, if I give you another urine pot to come back with next week, bear with me, I'm just going to get one, all right?
Okay.
As a urinary tract infection in men is more difficult to get, we do worry, could there be something more underlying? Things we'd worry about are blockages or any potential cancer in the bladder. This was the first time I'd met Mr. Collins because he's not my registered patient. I could tell that he suffers with a mental health illness. I can see this from his notes. UTIs and other infections can cause confusion and can make mental health symptoms worse.
This is the truth. I am possessed, not by demons, but a state of telepathic communication. Others may try to use it.
There we go. So if you do another urine sample and bring it back with you when you come next week.
Okay.
All right, there
Thanks
we go.
very much.
So take that to the desk and they'll book that appointment for you.
Okay, thank you.
Okay, let me get the door.
Cheers.
Okay, all the best.
All right, bye.
Bye-bye.
Oh, sorry. Just had a spillage.
OK, what can I do for you?
Open your mouth for doctor, please. Can you see his tonsils?
I can't from here, but I'll have a look in a minute.
Okay,
Yeah,
they
so
are huge.
tonsils remain huge.
And terrible snoring. You can keep you up at night.
So that was the next thing I was going to come
I
on to.
can keep anybody up at
The
night.
other
Can
thing,
you?
Yeah.
Are you a great snorer? Can you do an impression of your snoring? You're a great snorer. Fantastic.
sometimes when he's really tired, he'll get to a point where you think he stopped breathing. He'll go in,
Yeah, well, I was going to ask you about that. So this is at night, you mean?
Yeah,
In at
yeah.
night, yeah.
So he'll go in, and you think, oh my goodness.
Can you do an impression?
So
of
he'll
it?
do. And you're thinking, when's it going to come out? And then he'll just go.
Okay. Does he actually stop breathing in his sleep?
There's been nights when I've actually checked on him thinking, what's happened?
Yes.
So yes, he has stopped.
Alrighty. Can we have a look at you?
And certain things seem to bother him. Certain types of music, not all types.
Okay. Well, I have that
with
problem,
like a
but
heavy
yes.
sort of bass.
Yes, okay.
Can't take it.
Did you hear that Mummy was saying?
No.
So sometimes when you listen to music, you find it a bit difficult. Are you aware of that?
He dances to the music at home.
Does he?
Man, crazy.
Okay, take your head back slightly. Let's have a look at these amazing tonsils that Mum's been talking about. Good lad. You're absolutely amazing, aren't you? I mean, I think this lad should be seen by ENT. He has got large tonsils. They're not the largest I've seen by some way, but they're quite large enough. So, you know, it all ties in together. He is, in an old-fashioned parlance, what we call a coryzal child, a child who's got big tonsils, got big adenoids, got slightly nasal sort of speech with it, and it's a syndrome that goes together. And I think ENT should be seeing him and deciding whether his tonsils and adenoids need to be removed.
Okay.
Is that all right?
Yeah, perfect.
Yeah. Okay.
Anya.
We'll see how it goes. All right, but I will get a referral letter off.
That's brilliant.
Okay, cheerio then.
Thank you.
Bye, Faye. Bye-bye.
Bye. Right, come on then. Home.
Oh. I'll have to take phone calls in here. Hello?
Valentine.
Yeah. Okay, I've got to go. I'm going into the doctor's now. Okay. Speak to you tomorrow. Okay, bye-bye. Sorry, that was the...
That's all right. Hello.
Hello. Long time.
Yeah. How's it going?
A bit up and down.
All right, come on. Okay.
Some positives, some negatives. Okay.
All right. So, what can I do for you today?
Well, I will ask you if you can help. My last Laurel's appointment, I talked about the gender recognition certificate. I need a supportive letter, one from my GP. I think it's just basically needing to know that I've been presenting myself consistently as female.
As I've said to you before, I am going to be quite happy that this is something that you've presented to me consistently, so you don't need to worry about me signing it when the time comes. All right?
Yeah.
So,
for a panel,
application for gender recognition certificate, OK?
So that's that. There's another thing. I talked to him about operations.
A breast construction.
Yeah, OK. She gave me two things that she required from me. One was to lose weight, and I've actually lost quite a bit of weight. I've reached the goal where she requested what I need, because no surgeon will touch me or go ahead with anything unless they can verify that I'm physically fit for it. you know, physically, not mentally, but physically fit.
Okay.
And
There'll
I'm
be no
happy to-
reason why you can't physically have an operation. Mentally, that's more a different thing, you know, whether it's the right time psychologically for you. That's more for the Laurels to consider.
My question of mental health, I'm not questioning about my gender and the dysphoria, and, you know, that part of it, like, I'm quite stable in.
Well, I think as long as the Laurels agree with that, then that's probably going to be fine.
The question is over the mental state
Why
of all the other
why don't you
things.
talk to them?
So if I discuss the mental side of it with them, and then go back to have the appointment.
Yeah, and then if I get a letter, there won't be a problem.
So to say physically, that I am fit physically.
Okay. All right, Valentine. I'm with you all the way on that.
Okay then.
Okay.
I'll get it. Yeah, great.
Okay, doke.
Thank you
All
so
right,
much.
well,
thank you.
That's all right. Okay.
Yeah. Okay. Thank
all
you.
right then. See you.
Okay. Thank you.
Bye bye.
What can I do for you, Julie? You need a new name badge. Why? Yes, going to order you one. It's got to be yellow.
They got to be white. But then I had mine recently because they'd ordered it and they spelt Jackie wrong. Don't do the IE.
Hayley Beattie, please. Hello there. I wasn't hiding. Come on in. Thanks for waiting. I was having a little look at your notes.
That's okay.
Have a seat. Right, what can I do for you?
I've been having episodes, like last night, for instance, like I'm final day, my normal happy self, and then something just switches and I just cry, I can't seem to lift myself up and I can't find a reason for why I've just changed either. Like, nothing happened in the day yesterday. I'm having ongoing problems with my neighbours, which has been going on for a month, and I'm trying to move. I sort of put my Cody to bed, and then it just went down from there.
I've had ingrown toenails for quite some time.
Right.
And I have been cutting them out myself.
What do you mean cutting them out?
Trying to cut them as good as I can.
Because I'm on my feet a day at work, sometimes it is really uncomfortable. I just want to put my feet in cold water.
So as I press down here, is it okay there?
Have you ever had one of these before?
Yeah, and back home Pakistan, I have a both nails.
Oh, yes.
They took them off.
You don't want that to go up there. That's horrible, isn't it?
Usually they're like really like pussy. And like
I think it's because earlier I ran on the field and I felt something hurt on my foot and it popped.
What have you done?
OK, so I noticed that my big toenail was getting a bit thicker, so starting to grow extra layers.
OK.
And I noticed that on the other big toenail, on the other foot, and they've continued to grow layers.
When you see them, you understand.
OK, so...
So it's got really thick, hasn't it?
Yes, but it's very loose.
Let's have a look at your other one then. The nail is obviously very thickened. Oh gosh, yeah, you have got layers, haven't you? Yeah. That's strange.
Yeah, no, curiously, my wife has very thick toenails. We think it's possibly a hereditary thing.
How loose are they?
The first top layer sounds very hollow.
So, I mean, I think that these layers is pretty much dead nail. I think what's happening is that you've got a chronic sort of detachment of your toenail for whatever reason, and then I think it's basically just not coming off fully, so then it's just attaching to the one underneath each time. The only thing you're going to be able to do is go and see a podiatrist.
Right.
Really, and then they'll be able to treat them and sort it. I think the main thing is going to be to file them down.
I think it's an angle grinder time, isn't it?
There's no infection or anything like that, so it's not anything that's causing a risk to your toe or anything like that. Can I take a photo? Then I know for future reference if I ever get any 16-year-olds with the same toenail problem in ever again. It's quite interesting. Layers, isn't it? Like an onion.
Yes, it is like an onion. Didn't think they'd be having a photo shoot today.
There we go. A podiatrist will be able to sort them out, and then once they've sorted them, it's going to be a case of just keeping them filed down so that they don't get really thick.
Thanks for your help.
You're not the only one with weird toes. My friend has toes that look like thumbs.
Oh, wow.
They're really weird. Who's teaser? See you later.
when I get really anxious and I start cleaning.
Right.
So I was up to about 3 this morning cleaning because I can't settle, and but I had no explanation as to why. It just switched like that.
So how long has it been like that for?
About 4 or 5 weeks now.
And you've suffered with anxiety in the past, haven't you? Are you on tablets for it?
I'm on sertraline, yeah.
100 milligrams. And how long have you been on that dose for?
Quite a while now.
And what's happening with you at home at the moment?
I'm having ongoing problems with my neighbours, general intimidation. You know, I have to walk through them every day because they sit outside. I've been on to the council, the housing officer, so I'm hoping to be moved soon. So I'm just trying to keep myself to myself. I'm walking through it now because at the beginning I was shutting myself in and I didn't want to come in, but now I kind of hold my head out and I just walk out. I had complaints, I've got cameras, they put cameras up, and I've got one that faces up the drive, which is fine, but now I've got one that goes towards my front door. So it's like I have to live like I'm in Big Brother.
Right. And is it just you and your...
Just me and my son, yeah.
And how old's your son?
He's 3, coming up 4.
Any nasty thoughts about harming yourself at all?
No. Back in the past, in 2009, I did go through a stage of that, but I think my son keeps my head above that level.
How would you feel about trying some counselling or talking therapies?
Yeah, I did get in contact with one, but they were supposed to phone me back and they never did. I'm not very good on the phone, so I'm not very good at...
OK. Maybe it's something to look at again.
Yeah.
Because I think you're going through a lot, you know, with your neighbours and, you know, single mum as well.
Yeah.
You know, it's hard. So you can email them. OK, you don't have to ring them.
Yeah,
so that's the first step. You could do that.
Yeah.
Then they do like to chat on the phone, the next step. OK, but you can give a specified time and, you know, when you're at home safe and you can listen and that sort of thing.
OK, yeah.
And so you try and contact the Bristol Wellbeing Therapies. Either come back and see me, Dr Ramshaw, or your own doctor in, I'd say, 2 to 3 weeks.
OK, yeah.
Is that OK?
Lovely, that's brilliant. Thank you.
Nice to see you.
And you.
OK.
Thank you.
Bye-bye.
Bye.
Can I help?
See a question. Do you do nail cutting here? Toenail cutting?
We don't.
Age UK, look on...
Oh, Age UK. Bear with me 1 second.
Oh, that's all right.
Find the number for you.
That's one thing I can't do. I get the clippers hanging like this. Oh, God.
Aha, so it says 15 pounds.
No, I think I'll struggle on, don't you?
Okay.
Right, I don't know what it is. I seem to be waking up on a morning as if I'm drugged. And I do tend to get giddy. I seem to lose my balance rather a lot. Luckily, I can hang on to things as well. But if I get up too quick, obviously. I've got, I think, I don't know, high blood pressure. I think it's low blood pressure.
And how long have you been feeling a bit dizzy?
A couple of months, to be quite honest with you.
OK.
I'm 76 now. So it frightens me a bit. And I didn't know whether I was taking too many tablets. So I feel as though I'm taking too many tablets because I'm taking either 14 or 15 on a morning.
So if you get up to move, is that when you feel a bit dizzy, or is it when sitting still?
I go to get up and everything's disorientated.
OK.
I know where I am.
Yes.
But it's just getting from point A to point B.
Things. OK.
You know, and it tends to frighten me. I think I'm going to faint over in a minute, you know.
Once you've sat down, if you're sitting down, do you feel all right?
Fine.
OK, so it tends to be when you've got up to try and move around that you can't, that you're a bit unbalanced. Do you want to slip your jacket off for me so I can just have a listen? Lovely.
OK.
Yep, that's perfect. OK, let's just have a listen. You can breathe normally. I'm just listening into your heart for now. That all sounds fine. Let's check your blood pressure.
OK. As you can see what the tablets are doing.
Yeah. To be careful with you, don't we? You've got delicate skin.
Yeah.
138/71. That's OK, but maybe it's a little bit low for you at the moment. Yeah, so you've had high blood pressure, a regular heartbeat, and a stroke in the past, and you've got the lungs. OK.
Yeah.
You're on perindopril, and that lowers blood pressure.
I did 2 milligrams.
You're on 8.
She put me up to 8 because she said the arteries are too narrow
Yeah.
And she wanted to open the arteries to allow the blood to go through a bit quicker.
Yes.
So she said, I'm going to up it to 8.
That was about a month ago.
Yeah.
I just wonder whether that's what's made you feel a bit unsteady. Whether just that increase in dose, because that would fit with you feeling like this for about a month. Yes. I'm going to get you back down on the 4, just to try to see whether that makes a difference to this dizziness.
Yeah. How long is it going to be before I start noticing, if there is going to be anything, a difference?
A week? Yeah.
That's brilliant. Thank you very much. Thank you.
Is that okay?
Yep.
Great.
Have a good day.
Thank you. Bye-bye.
Thank you, love, for seeing me. Thank you.
OK, come and have a seat. What can I do for you?
Well, I've got like these random spots that come in about before because they were like they thought they were acne, but they seem to be like spreading like up here. They're in my eyes and stuff. I think they're in my ears, and they're really like itchy.
All right, and how long have you had them for now?
Maybe about 3 weeks. They just started on my arms, but I don't know if they're the same thing. But they're like, I've got tiny little ones in places that you can just feel like digging in, like.
Okay.
Almost my mouth and stuff, so I don't know.
So it's itchy spots. You've had them 3 weeks, and they're getting worse.
Yeah,
and we've
then
not
like
tried any particular treatment for them. So
no,
far.
it was just cream. Like they said to get some. They thought it was acne to get acne cream, so I just got like went to the pharmacist. Like I've been
Should we look at
scratching
your
here.
arm first of all?
Yeah,
I'll probably look under a bit of magnification.
No, that's fine. And then some of them are like really, really tiny ones.
Okay, let's look at this eye. Okay, what's your general health like?
Okay, I think.
Okay. Some of these you've scratched, I think. Is that right? Would that be right? Is that one not scratched? And that one not scratched? All right. Where else have you got some good ones to look at?
Do you want to see my back?
Yes, that's sometimes helpful, actually.
And my armpits are really itchy at the moment, so I don't know if they're in there.
Okay.
Sorry, it's quite personal.
Okay, let me just have a look at this. Again, I'm just going to look under magnification.
Yeah, no, that's fine. I think the more I touch them, the more itchy they are.
I think that's often the case. So when I look under magnification, what we see is a little red spot, often scratched, often with a bit of inflammation around the spot. And they look like septic spots. In fact, a lot of them look like something called folliculitis, which is where the hair follicles get inflamed, and the bacteria have got sort of scratched into the hair follicles.
Around my hair on my legs.
So this is a little bit tentative of what I'm going to say, but quite a lot of these spots would do for what's called folliculitis, little bacterial infections, so they're hair follicles which have got infected with staphylococcal skin bacteria. Okay, don't look fine. We've all got those. We've all got them. It's just some people they cause trouble and some we don't. Okay. I suspect you've scratched your legs. Maybe you've been a bit hot and sweaty. You scratched somewhere else and you've just spread the germs around, and this thing has.
Is it contagious?
Not desperately so. I won't say zero contagious, but not desperately so. Okay. So these are the things I'm going to recommend, okay? Firstly, I'd like to recommend that you cut your fingernails as short as you can, at least once a week, and file them down most days, so that should you be scratching, you can't be breaking the surface of the skin. Try and train yourself not to scratch these spots.
Just leave them,
Don't leave them, or if you can't bear it, just slap them, because slapping will relieve an itch a bit. Thirdly, I suggest we give you a course of antibiotics, and we'll do at least a 2-week course. I'll give you a small tube of a cream with an antibiotic in it that you can use on particularly itchy spots if they're really driving you crazy. All right? Then I think it would be prudent to get blood tests done, particularly interesting to check for diabetes or getting towards diabetes.
No, that's fine.
Because that can predispose to this sort of thing. I hope that things will turn the corner with that. If they don't, we'll see you back. All right?
I'll wait back. Thank you ever so much.
Cheerio then. Bye-bye.
Thank you.
The printer's not working. Do you know what it is? Oh, is that all you had to do? Oh, what's going on here? Private prescription. I don't know why it's coming out 100 times.
Right, I'll put that up now and it should work.
That is lovely, thank you.
Because it was a nice, easy one, I could do that.
Come and have a seat.
Breathing problems again.
Okay.
I think I've got another chest infection coming.
Okay.
I've fed up with it now. There's nothing, never gets to the bottom of anything.
Okay.
I've had x-rays, there's a shadow, it's decreasing, it's increasing, it's decreasing. Chest has been getting tighter and tighter, and now it's just like someone's permanently got me in a sort of bear hug sort of thing, finding it really hard to breathe.
Fine, okay. Any fever?
No.
Or are you bringing up any phlegm?
Green mucus.
Okay.
Whenever I cough, I bring up phlegm.
Are you a smoker?
Yes.
Yeah, okay.
I've had the cough for a year.
Okay.
Over a year.
Have you been feeling hot? Yeah.
Yeah, sweaty.
Yeah.
It's just like someone's just permanently squeezing on my chest.
Yeah.
It's all across here. I've always been worried about lung cancer because I smoke that.
Yes.
And the pain's getting worse and worse as the years go on. For over a year now, I've been backwards and forwards to doctors, to hospitals for x-rays. There's got to be something wrong. It can't just be nothing.
And where do you work? What do you do?
I work at a bar.
Long hours and things?
Yeah, that's what I've been doing, so I've just been getting really run down.
No, I work in kitchens.
What do you do in kitchens?
I'm a chef. So,
And where do you work?
I work in 3 places.
It's nice and relaxing. And what do you do?
In transport planning.
Right, transport planning. I think Bristol could do with a bit of transport planning.
You used to work in an oil rig, is that right?
Oil tankers.
Oil tankers.
It's been about 20 years ago, yeah.
How are you today? You all right?
Yeah, all right. I've been on my knees all day replacing floors. It's a dirty job, but someone's got to do it.
Indeed.
I used to be in the lifting game years ago. Removals.
There you go then.
Domestic and industrial.
The perfect job for you then.
Yeah.
Good morning.
Where would you like me to place it?
Let's go down this end, shall we? Then
Okay.
you can sit on that chair.
Yep, I'll do that. Is that right the way round or
It's
the other way
round, but
Oh,
never
I
mind.
should know that anyway, shouldn't I?
You should do after all
Yeah, I
this
should
time,
do.
shouldn't
Yeah.
you?
I'm a little bit scrambled at the moment.
How's the leg?
Well, I haven't had any distress with it, I've got to admit.
Right.
But maybe I didn't have them up. Well, that's looking better, though, isn't it? I think. It's looking a lot better than it was.
Yeah.
I think being on the move all through the day has helped it out. It's
Yeah, it's getting there, isn't it?
it's a silver lining, like, you know.
Red, yeah.
Yeah, lovely.
Let's have a look at this then. So that's good, isn't it? Good. There we go then.
But I would think, what would you reckon, another week or two on this one?
Yeah, another week or two.
Well, all I can say to you is have a nice end to the week, have a nice weekend.
And you, yeah?
Yeah, thank you very much.
Okay, take care,
You
bye-bye.
Take care, thank you, bye-bye.
It's not located down this side like it usually is. It's all across the top half of my chest here.
The pain that you're getting now?
Yeah.
Okay, yeah, okay. Are you working?
I'm a plasterer.
You're a plasterer, okay. Have we wondered about whether your work has anything to do with your chest?
I've changed jobs. I was doing things like plasterers. I wear a mask, I wear goggles.
Yeah.
Except for the other day when I went to the hospital to get plaster washed out my eye, but yeah. So I changed from building sites to private little home jobs now, working
Yes.
for myself. It's not so dusty, so.
And you've had a chest X-ray?
I've had 3 or 4.
Yeah.
I have to have regular ones.
Okay. The X-ray I'm looking at, they've said that there are prominent markings in the left lung base again.
Yeah.
Respiratory physician opinion could be helpful. So have you been to the hospital to be seen?
I've had no appointments for nothing.
Okay, all right. And have we done any breathing tests with you here?
I can blow perfectly all right on these tubes. Apparently I've got brilliant.
And have we ever got you to go into the treatment room to do some breathing
No.
tests? Okay, fine. That might be just useful to do as well. And you've had blood tests?
I've had blood tests, I've had this, that and the other done.
Let me just do the usual sort of
Usual
check
stuff,
your
it all
oxygen
comes
level.
back properly and clear.
Oxygen levels are good, 99%, so that's good.
Always comes back the same.
87. Yeah. Do you want to, if you were to lift up for me, that's great. And just take some deep breaths. Just lean forward for me. And take some deep breaths again. Okay. I can't hear anything down here different. I'll give you some antibiotics today if that you're bringing up mucky phlegm and you're feeling unwell. Any weight loss?
Weight gain?
Wait, have you been gaining weight? Okay, okay. It sounds like we ought to be doing some more blood tests and some breathing tests and making a referral to the hospital for them to take a look at you.
Probably my lungs full of smoke.
Smoking?
Yeah.
Are you ever going to stop?
I tried one of those vape pens and my chest got worse, not better.
Okay. I mean, ultimately, your chest would improve. You know, it's better for your health overall to stop smoking.
Yeah.
Sometimes there is a really difficult bit when people first stop smoking. So there are...
I feel sick.
And that's probably the lack of nicotine, because it's the nicotine that's addictive.
Oh, yeah, I want to stop smoking. Obviously, I don't want to be a smoker. I don't want to kill myself, do I? I've got young kids. So.
Yeah, we've got people trained up here to support people to stop smoking. We know it's hard to do.
I'm willing to give anything a go that makes me feel better.
And
what about the hospital?
I'll make a note to myself now to make a referral for you.
Thank you very much.
All right.
Thank you.
OK. Bye-bye then.
Bye-bye.
So if you say newly nailed, it's there now.
Oh, brilliant. OK, thanks, Claire. Thanks for that. Cheers. Tanya's back on now, the phone, so all right.
Sorry, are you talking to me, Nigel? Just
I was trying to.
chewing a brick.
Hello there. I'm Dr. Bolam.
Yeah, hi.
And this is Harmen.
Harmeen.
Harmeen.
Yes.
Sorry. OK. OK. And she's just 4 weeks old.
Yeah.
And she's your third baby, is that right?
Yeah, she is. I've noticed this morning her nose was bleeding.
OK.
You can see this.
Oh, yeah.
This is bleeding this morning. But whenever she sneezes,
I see.
you can see it here.
OK. Are you breastfeeding her?
Yes.
OK. And is that going all right now?
Yeah.
I'll have a proper look at her in a minute. But how does she seem to you now? She seems well, does she?
She seems okay, but I just worried about the bleeding.
Yes. Okay.
Yeah. Yeah.
There's no rash on her.
Yeah. Her body was full of spots about 2 weeks ago.
And that's, in fact, getting better then.
Yeah,
is it?
yes.
Well, I'll tell you what, if you pop her on the bed and stay up there with her, and then we'll do a temperature and have a look at her nose and such like. OK? All right. Hello. All right. You doing some puzzles there? Very good. All right. OK. Right then, let's have a look at you then, madam. Hello. Hello, what's going on? What's going on? It's OK, so she's no temperature now. All right. 36.9. OK, right then. Is the blood only coming out of that right nostril?
I think so.
Like it is,
Yeah,
isn't it?
yeah,
Okay.
yeah.
Yeah, OK. Hello. There's just a little sore area on the edge of her nostril. All right?
OK.
OK. I'm not worried about that. OK. All right, she's well. She's no temperature. There's no worrying rash. She's feeding OK. She looks great. All right?
Anything I can give it to her?
I would just keep it clean. OK? Maybe boil some water, let it cool, put a little bit of salt on it and just, bathe it a couple of times a day with some cotton wool. Okay. Is that all right?
Yeah, that's fine.
She's fine. Congratulations.
Thank you.
So you've got a boy?
And 2 girls.
And 2 girls.
Yeah.
OK. And you the biggest? How old are you?
About to be 10.
You're about to be 10? OK.
10 days.
Oh, 10 in 10 days. OK. Cool. And how old's your other sister? 8. OK, so Mum's had a bit of a gap there.
Yeah.
OK, so you're remembering how to do it.
I totally forgot everything.
Yeah. It's coming back though, is it?
Yeah.
OK, all right, so keep an eye on that. Obviously, if anything seems to get worse or she goes off her feeds or you're in any way concerned, you bring her back.
Thank you so much.
All right, no, that's my pleasure. Have a good birthday.
Thank you. Bye.
All right, bye-bye now. Bye-bye.
Thanks very much.
Good news.
I shall see you later if you
Yeah, absolutely.
Thank you so much.
Good, nice to see you.
Thanks a lot.
Cheers,
Bye-bye.
bye. All right, not a problem. OK, all right. Thank you. Oh.
Take care.
All right,
See you later.
cheers.
OK. Come on then. Are you going to stay with me? Come see all my patients. Bye-bye.
Bye-bye.
I had that Baker's cyst down behind my knee. The amount of pressure now from, literally my knee downward, it's just so painful. I can't straighten my leg now.
So you OK having your bloods done?
think so.
Do you tend to faint?
I won't look, put it that way.
You won't know, no, but do you tend to faint?
His tears are bloody and there's a bit of blood in the corner of his eye.
Okay.
Just pull down your trousers, lie curled up in a little ball on your left side with your knees up to your chest, facing the wall. Are you ready?
Oh, I wouldn't say no to a cup of tea. That would be amazing. Georgina, I have a fund. People put in £5. People just help themselves to squash, sugar, biscuits, chocolate biscuits. There's hot chocolate in there. There's biscuits, mints upstairs. So if you want to join the fund, let me know. Oh, and Heather does obviously the milk fund as well. I don't know how much she charges though. I'm not in the milk fund.
Janet Shaw, please.
Yes.
Hi there.
Hello. I think I've seen you with Janet before. I'm her sister and carer.
I didn't see her there.
Of course, her little legs don't keep up with me.
Well then, come on in.
Come on in, Janet.
Hello, yes.
Hi there.
Well, unfortunately, Doctor, Janet has had skin cancer this summer.
Right.
And had an operation.
Right.
But I'm not happy about what's happening here at the moment.
And what has been happening?
Well,
Tell me a little bit more.
I looked today and it was weeping.
Right.
And I don't quite know whether to cover it up or let it just go.
And has it grown at all, or has it just been weeping?
Very quickly.
Has it? So it's grown quite a lot?
A fortnight ago, we went to see the dermatologist on a Saturday.
Oh, right.
She got to have another operation.
I see. So the operation is coming. Did they say what kind of skin problem it was?
I think it's carcinoma.
Basal cell carcinoma is one of them?
That's it.
Is that the one? OK. Have you been in touch with the dermatologists?
No.
We need to get the message back to them, don't we? So that they can then see what they want to do. Can I have a little look?
Yes. But the other one, it was just warty, like a wart. But this one is like more ulcer.
Yeah. Because I think it does look like a BCC, and they can sometimes get an ulcer in the middle. It doesn't look like it's infected to me, so I'm not worried that there's something else going on, and I will write to them telling them that what size it's got to with the ulceration and the weeping, and otherwise I'll just cover it over. I will see what they can do.
OK,
and ask them to give you a ring. All right. Bye. No problem. Nice to see you. You go well.
Bye.
Jolly good. Bye then.
Bye.
Lene, please.
Come on, then.
Come in. You're all colour coordinated with your dress and your shoes. Thank you for waiting.
That's all right.
Right, which one are we seeing? This one?
Yeah.
You? Do you want to play with the trains? Do you want to play with these? Have a play?
You watch
Okay, that one.
yeah?
Right, what's been happening then?
Well, she's been complaining that she doesn't feel very well. But then last night she wet the bed, which is very unusual for her, and she's been going to the toilet like every half an hour to 45 minutes, and she's done 4 poos as well today.
Oh, right, OK.
So, yeah, it's quite unusual for her.
Any diarrhoea at all?
No, no diarrhoea. And she, I don't know if she understands, but I've asked if it burns or anything when she wheezes, and she says no.
Right, OK.
But it's just more, she keeps saying that she doesn't feel very well.
Right, OK.
I bought you a sample just in case.
Brilliant. Do you think she's had a fever at all?
No, she's been normal, like normal behaviour.
Let's dip this then. Has she had a urine infection ever before?
No.
Hello? No. I'm going to dip this in here. See what it says. Let's just give that another minute.
OK.
Can we pop you on the bed so I can feel your tummy? Oi, God, you're heavy. Right. Are you ticklish? Yeah. There? There? Right, let's have a feel of your tummy. Does this hurt anywhere? No? That's okay, that doesn't hurt. Fabulous. Okay. Right, you want to get down again?
Ready? Jump.
Oi.
Good girl. Sorry. Come on then.
See what this is saying. Oh, yes. It has developed. Yes, she's got a urine infection.
Okay.
Okay. Now, what we'll do is, with children, we send their urine off anyway, just in case it doesn't respond to the first lot of antibiotics that we give them, then we know what to give them next. So
Yeah.
I'll send that off. But if she's getting worse at all, you think she's developing a fever, she starts saying she's got tummy ache or anything like that, ring 111 straight away so that they can see her out of hours.
Okay.
And then just loads of water.
Yeah. That's fine.
All right?
Thank you.
And I'll bring this out to you. If you have a seat in the waiting room, and I just need to sort this prescription out, and I need to get the duty doctor to sign it.
All right. Thank you very much. Say thank you.
Bye-bye. See ya. Right, how can I help?
So from Saturday night, I had like really intense chronic stomach pain, and then intense pain again Sunday all the way through the night. So it's basically every evening or earlier, it's just like chronic pain. Sometimes it's like a burning sensation here.
And during the day, it seems okay, or it's gone,
just really
or
sore.
easier?
Yeah, it's just really tender at the moment.
So it's mainly the pain that's bothering you, and you're off your food, you don't feel like eating. Any vomiting?
Yeah, twice last night.
You don't smoke, generally fit and well.
Yeah.
When was the last time that you took any paracetamol?
I tried to take some last night, but I was sick afterwards, so that didn't really happen. And then I got given cocodamol last night, and I was going to take one before sleeping, but then I was actually like quite sick, so didn't take any.
Open wide for me. Big amounts of vomit?
It was just like the little amount of food I ate.
Have you had anything to eat today?
Half a slice of toast.
And that's it. And you haven't really been eating well since Saturday?
Yeah, so about a slice of toast a day, maybe some natural yoghurt.
If you come and have a lie down here, so you haven't travelled anywhere in the last month. Did you go somewhere before that? It sounded like you may have done.
I was travelling Asia for 7 months.
But were you well after that?
Yeah, really well.
So did you get any tummy bugs or anything while you were out there? Because it's sort of standard.
Yeah, so I got a few there and, like, obviously know how bad that gets, so I wouldn't be going to A&E unless it was chronic.
The pain's worse at night, but it is there pretty much all day?
It's tender now, so, like, if I was in the pain I am at night, I would definitely be like, oh, that's a bit tender there.
OK, that's quite sore for you, isn't that? I'm sorry.
It's fine. I'm just worried of what it is.
Hello, it's Cultman Reception.
Hello. Just wash it. That's fine.
Hi, it's Dr. Ramshaw from Hallfield Health Centre.
Hello.
No problem.
The dog really needs a haircut.
They don't do buy one, get one free.
I'll sort that out for you.
Tell me what tablets they were.
Hopefully that should clear it up.
Bye-bye.
See you then.
Bye.
Cheers, bye.
Yes.
OK, all right, in you come. All righty. I haven't seen you for ages.
I know, isn't that good?
Well.
This is about my knee.
OK.
You know, I don't know if you knew, I had that Baker's cyst in the back, and the thing that they wanted to go forward with was injections into the kneecap, and I just really didn't want that because, well, I know a few people who'd had it done, it didn't necessarily work, and from what I'd read up about the cyst, it might strengthen my knee, but it wouldn't necessarily do anything for that.
OK.
Now, this is filled into such... Because I've been sat with my leg bent. I pull my wheelchair forward like this because I'm so weak down one side. I can't use both hands, really, to wheelchair.
Dragging it with your leg.
And I've been doing it for years. It's just filled up so much I can't straighten my leg now.
Right.
round behind my knee.
What would you like me to do today then?
I want to.
I will have another look at it.
I'd like to know if we can drain it, because the amount of pressure now from, like, literally my knee downwards and what it's doing on this foot, it's just so painful.
Maybe we'll do this with you on the bed, Alison, actually. Is that all right? Might be
yes.
easier.
It's just so painful to actually straighten my leg. It's...
Yeah, OK. So if you can hop over and lie on the bed on your... probably on your front, actually.
OK.
Have a look at that.
Yeah.
A Baker's cyst is a fluid-filled swelling that develops at the back of the knee. Sometimes it's caused by trauma or by osteoarthritis or some other form of joint problem.
I went to Liverpool last week.
OK.
And it was...
You've had a top-up on your accent.
It's... I have, actually. That's funny you say that. But I got, like, one day in and it, literally I couldn't even pull myself round just anymore.
OK. Swing yourself around. So, I still think it's a Baker's cyst, OK. What do we do about it? I'm not just going to stick a needle in the back of the knee myself, because there are other structures in the back of the knee, and, you know, you could do harm. OK, I'll ask for an ultrasound scan of the back of the knee just to confirm it's a Baker's cyst and there's nothing else going on, all right? Simultaneously, I'll also refer you to the musculoskeletal assessment service for them to advise on what's the best way forward, which I suspect will involve the help of an orthopaedic surgeon. Actually.
OK.
Yeah.
Thank you.
Is that all right? Is that a plan then?
That sounds
OK,
brilliant.
so I'm just going to write in my book to get those two things done.
I was worried you were going to say, well, actually, steroid injections under the kneecap is the only way forward.
No, I think it's a bit too big for that, actually, to be honest. Yeah. When you go for your ultrasound, you'll get an appointment through the post for that. OK, I'll do those referrals.
Thank you.
Yeah, lovely to see you.
Thank you.
OK, go for yourself.
Bless. Have a good day.
Cheers.
Let's just have a check of that. So there's no sugar in your urine. There's lots of ketones. I'll explain what that means in a second. No signs of infection on this sample. So ketones in the urine means that you're getting a bit dry, a bit dehydrated, and you look a bit dry, a bit pale. So I think we've come to a stage where you would benefit from having some fluids through a drip and some blood tests just to see what's going on, maybe an ultrasound scan. It's not fitting into an appendix kind of picture, but it could be pyelonephritis, which is that you get a kidney infection, but the urine's not always showing anything up. But I think we've got to a point that we need a bit more help with it. You haven't got a temperature or anything like that. Your blood pressure is a bit low. And that's also why I'm a bit worried about you being a bit dry.
Yeah.
Is there anyone who can take you up to the hospital?
Yeah, my stepmom's coming at
All
half
right.
an hour.
You look very upset.
I am just worried.
What are you worried about?
Just that I don't know what's going on.
Yeah, OK. But you're dry, and we need to just pep you up, do some blood tests and see what's going on. Yeah. You don't have to wait in the main area. I can give you the side room to wait and make a call.
Yeah.
And I'm going to speak to them at the hospital about this.
Thanks. Cheers.
All right?
Yeah, that's great.
You know there's a water fountain, so it'd be good to drink some water.
Yeah, gonna drink some more.
So if I show you where that is, because
Yeah,
I'm just going to make a call. Don't forget your things. All right?
Thank you so much. You've been
That's
really
okay.
helpful.
Just got a lady in here, OK?
Oh, yeah, cool.
Just in there.
Thank you.
That's OK.
Not very good with needles.
Not many people are.
If you want to have a look, that's fine, but just in case it makes you feel a bit funny.
Do you not like looking?
No.
I've got good veins. Yeah. My best friend's a midwife and she loves my veins.
I find it satisfying watching this.
Flowing well today.
I'm sweating.
Oh, you just keep on taking the blood.
Got me sweating as well.
Shan stock.
All right, if you just want to come take a seat.
Hi.
How are you? You all right?
I
think so. I think so.
Good. Just going to do a quick blood test. Are you OK having your bloods done?
I think so.
Do you tend to faint?
I won't look, put it that way.
You won't. No, but do you tend to faint? Do you think you'd be all right, or would you prefer to lie down?
No, I'll be all right. All right.
Yeah?
I just won't look.
All right. Not many people do.
Is that so? All right, so I'm not abnormal then?
No, I don't look when I have a blood test taken, and I do it for a living.
Okay. So this blood test is going to test all sorts of things, is it?
This is going to test your HbA1c, which is your sugars, full blood count, which will check your red blood cells and white blood cells, haemoglobin, electrolytes, which is your kidneys, your liver function test, which is your liver, lipids, which is cholesterol, and your thyroid.
Right, OK.
So giving you a bit of a...
They're all over the same?
Check-up, yeah.
Right.
Are you OK with plasters?
Yeah. No problem with that.
All right. Okay, I'm just going to wash my hands.
So this is all part of this sort of health check, then?
Yeah.
Yeah.
So this is the reason why we're doing it, is just because it was advised that you needed the blood doing. All right.
Right.
Your BP was done
yesterday.
Last time. Yeah. Oh, it was yesterday, was it? And that was okay.
Yeah.
So that's good. So now we just need to wait for the results of the bloods.
So yeah.
All right.
So...
Which time do we go for when taking bloods?
Oh, let's go for that one, because I can look this way, can't I?
All right. All right. Do you want me to tell you what I'm about to do? No, just go ahead and do it.
Just go ahead and do it. Yeah.
All right. Oh, bless you.
Yeah, I used to give blood very occasionally.
Yeah.
And the last time I gave it, I keeled over completely. And they said, "Oh, please don't come back again." And I said,
really?
"Well, don't write to me then. Keep asking me."
Yeah.
So they haven't since. How much you taking?
Just two small bottles, all right?
2 small bottles? Gee!
Well, no, not bottles, but like 2 blood vials.
Right, OK. I imagine it's a massive thing now. Is it all done?
No. All right.
All done?
All done.
Oh, fantastic. Yep. That was amazing.
Oh, thanks.
Yeah, no, brilliant. I've been gearing myself up for this.
Oh, bless you.
It's ridiculous, isn't it? It really is.
No, it's not. If you bear with me a second, I can pop a plaster on.
Right.
All right. Don't want you walking out of here and leaving a little trail of blood behind. Scare off the rest of my patients, you will.
So the results, will they tell me?
The results will be back in 3 days.
Right, OK.
And we can give you the results over the phone.
Right, OK. No, that's brilliant, yeah.
Let's pop a plaster on for you.
Gee, that was a lot. I got to eat and drink loads tonight, haven't I, to make up for that?
Such a big amount. All right.
Probably stopped, is it?
Yeah, perfect.
Right.
Souvenir to remember me by.
Excellent.
All right.
Thank you so much. Nope, that's brilliant.
No worries.
Have a good afternoon.
And you, take care. Bye.
Thanks. Come along in and have a seat. You OK there?
Yeah.
Right. How can I help?
My tongue is hurt.
OK, your tongue is hurting.
Yeah.
OK.
My throat.
OK.
Burning.
OK, your mouth and throat are burning. OK, yep.
And it like sandpaper.
OK. Fine. How many days? How long has that been feeling bad?
For a while.
For a while. OK, OK. And are you feeling well in yourself otherwise?
I'm low emotionally.
Just say that again.
I will write it.
OK, OK. I didn't quite catch that bit, so that would be helpful. OK, so you're a bit low in yourself. Yes. OK. Shall I have a look at your throat in the first instance? Actually, I'm going to start off by just checking your temperature. So, can I put this in your ear to check your temperature? OK, that's great. That's fine. That's not that. No fever. OK. And now let's have a look in your throat. That's great. And just say ah. Ah. And again. Ah. Fantastic. OK. I can't see anything, any muck in the throat. Let me have a little feel. Can I just feel your neck?
Yeah. This is it. There.
That feels sore there. OK. Are you able to eat? OK. I think, as I say, the throat looks OK. I can't see anything particular in your mouth, but I think if it's feeling sore and it's feeling like sandpaper, something that might be causing you problems is thrush. That can make your mouth feel very uncomfortable. It's a very simple treatment.
Yeah.
And then if that doesn't help, you can come back and see us. I'd give you a week's course and see if that would help. OK. The other thing you said was feeling quite low emotionally.
Yeah.
Do you think that's tied up with your mouth getting you down, or is that a different thing?
Different.
Different thing?
Yeah.
OK.
Different thing that I'm a human being.
I think I'm going to need to get you to write that bit. I didn't quite understand. Oh. That's how you feel, that some people are disregarding you as a human being.
I'm a human being with a disability.
Yes.
Well, the disability is not the hard thing.
OK.
Take a seat then, OK?
Are you ready then?
It's a digger, isn't it? I'm not digging that at all. Oh, I can't bother with that. What about this one? He's riding a kangaroo.
Hugo, please.
Come on.
Hiya.
Hello, how are you? Hey, how are you doing?
Morning. Yeah, good, thanks.
Good.
Hiya, so what's been happening to you then?
Hugo fell down some stairs this morning. He was coming down the stairs behind me, and I turned around to like pick some wet wipes off the stairs, and he just like came down in front of me, and so I caught him on the rebound. I don't think he was that far behind me, so I think he maybe fell down a few steps straight down onto his head. And cried a bit.
Sure.
And then stopped crying, and I thought, this is cool. But then I noticed there's a bit of, like, his tears are bloody, and there's a bit of blood in the corner of his eye.
Okay.
So they're like carpet-covered wooden stairs, and he cried for...
And he landed on the stairs rather than on a stone or anything harder?
On the stairs, yeah. On the stairs, yeah.
But he hasn't been sick or had obvious problems with his vision or...
No, he's been really perfect.
Using his arms and legs all normally?
Yeah, everything
Eating
fine.
and drinking fine?
It's normal.
Just got this bit of blood since
yeah.
then. Hello.
He might have stopped
Hello.
now, but he was
Can I
there for a
approach you?
while.
Can I tickle you? Right, let's have a little look. Look over here. Good boy. Look over here. So his eye itself seems absolutely fine, doesn't it? Just a bit of bruising just underneath.
Yeah.
There is just a little bit of bruising just under the eye, and I think you're right. I think he's just got a little bit of tiny burst blood vessel there. In fact, right in the corner of his eye, I can see.
Yeah, that's where the blood was coming from.
But the eye itself looks completely fine.
Yeah.
And he's moving it around completely normally, and he's following, and he's obviously interested in, obeying my instructions and doing everything he should be. So that all looks fine. Let's just shine a light in it. Good boy. Can you smile for me? Give me a lovely smile. Can you give me a smile? You've already shown me that you can do a nice smile, so I'm not too worried that there's anything else going on there. I think my sense is that he's just got a minor head injury from this fall, and that this is nothing that we need to be worried about. I think he's going to get a little bit of a black eye, and you know, that's OK. What we don't want to see is him vomiting, him having obvious visual problems, getting drowsy. Those are all the sorts of things we get worried about with head injuries. Obviously, if he had a fit or started getting drowsy or you were worried, then bring him straight back and we'll do something more. Then we'd need to get the hospital involved. Yeah. But, you know, head injuries are really common in children, and as long as they're minor and we're not worried that he's done himself any major mischief, which is the case now, then actually we can just keep a really close eye on him and he'll just get on with life as normal, I'm sure.
Yeah. Thank you.
Does that answer all your questions? Super job. And obviously just some Calpol.
I really wasn't worried. I mean, if I thought anything was really bad, I'd have gone to A&E, I suppose. But
super job. Nice to see you then.
Thank you.
Bye. You going to give me a wave? No.
Say bye-bye. Say thank you.
Bye.
Good boy. See ya.
Bye-bye.
OK, so you have a disability, but that's not the whole thing.
Yeah.
Yes, OK.
And...
So you feel everything is put down to disability?
Yes.
And that's not how it feels? Yeah, that's...
And I'm supposed to be having some counselling.
Some counselling, OK.
But nothing seems to be happening.
OK, this is going back a little bit, but there was a plan for you to have a scan of your head.
Yeah.
Has that happened?
Yes.
OK, and do we know the result of that?
I don't really understand it.
OK, let me just have a quick look. Let me have a look at the last letter. Well, here we go, right. They found something very, very tiny that they want us to monitor. It's that the presence of this little something in the pituitary gland in the head, they suggest that it's not a good idea to prescribe you medication that they had considered because it's there, and that you're to have annual, yearly blood tests to look at the prolactin, which was that hormone that was found to be a little bit high. The main role it has really is in breast milk production, but it is also important in terms of regulating the periods as well. But I think though yours was a little bit high, they've sort of found that there's just a little tiny area within the pituitary that's producing that little bit too much of it. Yeah. OK, I think what I'm going to do now, because I'm slightly running out of time today, is to leave a message with Dr. Clark to just ask her whether or not we need to do any looking into your counselling.
Yeah.
OK? OK, so that's a prescription for your mouth. And let's see if we can get that feeling a bit better for you.
Right.
All right.
Yeah.
There we go. Yep. All right then.
Thank you.
OK, nice to meet you.
Nice to meet you.
OK, take care.
Bye.
Bye-bye.
Oh, it's you.
Yeah, you.
Good. Just finished?
Well, yeah, in a second.
Oh.
I had a card today. I'm really chuffed with it. Oh, it meant so much to me. I'm patient, but it's really, really nice. I cried.
Oh, what? So thank you. Oh.
Yes, I'm chuffed.
Look at you.
So when she gave it to me, I was like, there's just tears, so we just come in.
I was like, you stuffy thing.
Oh.
So nice. Have a seat.
Oh.
How can I help?
My bladder.
Your bladder, yes.
I'm now peeing since I don't sleep.
Yeah.
It's hard to say, but every hour.
Yeah.
Day and night.
Right.
And sometimes even more than that.
Why do you think you've got a problem with peeing?
I have no idea.
So
I pass a huge amount as well. It's not like a tiny bit. It's like, you know, pint.
Really?
Yeah. And I just don't know where it's coming from.
Do you drink quite a bit?
I drink a lot of tea.
Yeah. How
when
much?
I'm working in the night. Maybe 2 cups of tea in an hour, say, perhaps.
So do you drink 2 cups of tea every hour overnight?
Yeah.
So that might be that you're drinking 10 to 12 cups in 24 hours of tea.
Yeah,
at
definitely,
least.
definitely.
Yeah.
Yeah.
What about coffee? How many coffees in 24 hours?
Maybe 3.
Any other fluids apart from tea and coffee, or is that your main
Water.
fluid intake? And how many cups of water would you have in 24 hours as well?
4.
OK. So when you add all that up,
yeah,
And if you were to do a sort of fluid balance thing, and you were to look at how much fluid you're taking in and how much you're peeing out, it may not be that different, but the difference is that at the moment you're awake all night, which you aren't normally, or you aren't always, shall we say. The problem with tea and coffee is they've got caffeine in them, and that makes you pee more.
Does it? Right.
Definitely does, yes. Okay, so that one of the things that you might find helpful, whilst we try and work out what the matter is to get some decaffeinated tea.
Yeah, I could probably drink... Leslie drinks decaffeinated tea.
Does she? Yeah. OK, well, why don't you switch to that in the first instance, see if that makes any difference.
That'd probably be all right, because it tastes...
OK. How long do you think things have been worse for with your urinary frequency and urgency?
6 months.
Are you worried that there's something a bit more significant going on?
Not because you told me that, you know, you've examined my prostate
Is that
relatively recently. Well, I came in and you told me you'd done it the year before, I think, last summer.
Here it is. It was June 2015. But I guess we could do it again because it's changed so much in the last 6 months. Do you see what I mean? Do you want me to do that now?
OK. No, it's fine.
Get it done?
Yeah.
Yeah, just to see whether your prostate has got bigger. So I think, but we ruled out diabetes. So I think I should examine you, you should have a blood test done, and then we should discuss the result and work out what we're going to do next. But I think if you reduce your decaf, you might be a lot better.
Lifestyle change.
Yeah, you're good at that, sometimes.
What does it mean?
Reducing the amount of caffeine. Just pull down your trousers, lie curled up in a little ball on your left side with your knees up to your chest, facing the wall, OK?
There's a big fuss made about this test.
There is.
Which I think is silly.
About which test?
This test.
Oh, having...
There's nothing horrible about it. It's perfectly
not too
fine.
bad, is it? No. You ready?
It's the next one, yeah.
It's the next one?
Yeah. Put in a camera or whatever.
Yeah, that's absolutely normal. You have not got a big prostate.
Good.
OK? Now, don't fall off as you get dressed, because it's a really unusually narrow bed, OK? OK, so unfortunately, we haven't got anyone who can do bloods today.
OK.
But I don't think it's urgent. I think just have the blood test done in the next couple of weeks, OK? That's for you to have a read. Is that all right?
Yes.
Today? Yep. Great.
Cheers.
Very good. Bye.
All right, how are you doing? We're right down the end of the corridor. A bit of a long walk. Nice bit of exercise. Come on in, take a seat. Okay. Right. You okay there?
Yeah, fine,
All right. So, I was just looking at your notes from last time, because you saw Kaylee, didn't you, last week?
Yes, I did, yeah.
And you weren't feeling too good, were you?
No, I don't know what it is. I think I've got conjunctivitis as well. Some stupid thing going around in my head.
Your eyes look okay. Do you want to take your glasses off? Let me just have a look.
Yeah, sure.
Are they very weepy? Are they sort of crusty?
Just a film across them.
Right. When you wake up in the morning, is no crustiness or?
No, that's not there.
They look absolutely
They look
fine
all
at
right.
the moment. Yeah.
It's got to be my glasses gone wrong. I need a new pair,
Yeah.
definitely.
Would you like me to give them a little bit of a clean?
Please, they've been through the wars with me.
Yeah.
So I don't want to get rid of them.
So are you
but
feeling a bit better now?
Oh, yeah, from that, yeah, I am.
Good.
I blamed whatever I had on my eyes as well, mine, but I blame everything on that.
Try that.
Yeah, thank you. That's because these are designer. I paid a mint for them. Oh, that's see everyone now.
Is that better? Is the filminess gone?
Yeah, there. I'm I'm talking to you now.
Okay.
Oh,
So let's have a look at your leg. Is it?
Yeah, here you are. I thought my new stockings have come through. Sorry I didn't bring them in today.
That's all right.
I did change it the other day.
Okay. Just pop your foot on the tissues for me.
It's on a leak.
Yeah. Because, like, usually we put a big pad on, don't we?
Yeah.
So you changed that, did you?
Yeah, it leaked the week before. It leaked everywhere. And that should be under the foot as well, that dressing that you Just taking off that long yellow line.
Yeah.
It's not very nice there.
It looks like it's half off this one anyway.
I think that's going to need a bit of dressing help.
So it's not oozing any liquid, is it?
Our nurses are the experts as to what's the best dressing, so we'll go with their advice.
All done.
Lift your foot up. Just so until you hit that. Have you still got your lodger with you, or?
I do, yeah.
Yeah.
I do.
Does that work out? Or...
He's gone away. He's gone. he's a kind of carer, so he's only sort of part-time with me.
Oh, yeah.
Yeah, he's gone away.
Oh. Does that feel okay?
Yeah, very, very nice. Thank you. That's it.
Yeah?
Yeah, that's fine. That's lovely.
You sure?
Yeah,
Win?
that's lovely. Yes, thank
Don't
you.
be tripping up. Well, it's nice to see you, Linda, and...
Yeah, thank you very much, Sue.
No worries. You come up with me now.
OK, thank you.
We can...
OK, that's lovely. Thank you very much. Yeah, thanks very much.
Gonna be... Riley Warner?
Oh, that's me. Sorry, I'm so late.
I'm late anyway. Have a seat.
I'm absolutely boiling.
Right, what can I do for you?
Well, firstly, I wanted to get another prescription of the pill.
Right, OK.
But then I also have been looking at getting the coil. Because
OK.
I'm not very good at taking it regularly.
It's a good reason to consider something else.
Yeah, because I did have the implant and I didn't really like that.
Yep, no, it's a really good option. So have you looked into the two kinds of coils?
No, I haven't.
Right, OK.
Right,
so there's two kinds, two main types, OK? One that has a hormone and one that doesn't, that we call the copper one. So the simple one is the copper one that works as a contraception, as a device in the uterus, OK? And it releases copper that stops you getting pregnant and stops implantation. So it's very effective.
Yeah.
The downside of the copper one is, or it could be, not with everyone, it can make the periods a bit heavier. So the hormone one, OK, we fit it the same way, but it releases a small dose of progesterone. OK.
Yeah.
So we suggest giving up to 6 months to let it settle down. So when I say settle down, I mean you might get irregular bleeding.
OK,
all
so
right?
it might be a bit kind of
all over the place. But then it often does settle, and in many people you get either very light, occasional bleeding or nothing at all.
OK, yeah.
So the other thing to chat about is how we insert it. So have you ever had a smear test done?
Yes.
Yeah, so it's a little bit like that, OK?
In the same kind of procedure.
Yeah, exactly. So the doctor does it with the assistance of a nurse, OK? So it takes about 10, 15 minutes. So when we put the coil in or when we use the other instruments, there is an increased risk of perforating the womb.
OK.
So that's a risk of about 1 in 1,000.
OK.
There's a risk of infection. There's a risk of it coming out. OK? If you had a very heavy period or something like that.
Just check it.
Yeah.
OK.
Yeah. So the other difference is the copper can be inserted for 10 years and the hormone one is for 5 years.
Wow, OK.
Yes.
That's quite long.
OK. So shall I give you some information about them?
that would be great. That would be really great, please. Yeah, I don't think there's any other questions. I'll read this and probably
so
have loads of questions
well,
afterwards.
that's fine. Just give us a ring and
OK.
we do telephone consultations so I could chat to you.
Oh, OK. Oh, that's brilliant, yeah.
Okay.
Thank you.
So in terms of your pill at the moment, so should we just give you some for now to be going on with?
Yeah. Maybe give me another month or something.
Yeah,
Just,
OK.
so I've got... Just in case.
Yeah, no problem. You can have it fitted any time of the month, really, as long as you're definitely not pregnant.
OK. Ah, that's good to know. Yes, thank you.
Yeah, no, it's a really good form of contraception. You can have it removed when you need to. Those leaflets are quite good, so have a little read.
Thank you very much.
OK, no problem. Well, good luck on your decision.
Thank you very much.
OK, no problem. Bye-bye.
Freddie, please.
OK.
Hello. Don't recognise you from it. I think you've changed your hair or
Yeah.
it back. Right. Hello, Freddie. Sorry, it's not. This is about you, isn't it? Let me go grab another chair. Okay. There we go. You seem to have grown.
Yeah, getting bigger.
Oh.
So, do you want to tell Doctor first, or do you want me to?
You.
So Freddie's just started having a stammer.
Right.
It's not all the time, and he's always sort of had it there, but lately it just seems to be getting worse.
And so how long ago do you think this started as a thing?
Quite long ago. But it's just getting, like, worse and worse.
There was a time when it didn't happen at all?
Yeah, you didn't always have a stutter, did you? Like a stammer.
No.
Are there times when it's more likely to happen?
It's mostly when I'm speaking to lots of people as well.
Does it happen at home?
Yeah.
Yeah. So mum, you hear it.
Yeah.
Yes. Okay.
You know, it might be 3 or 4 times a day that he'll do it, but and then other days it'll be like constant, and he's really getting stuck, and he laughs at it.
Yes.
But I think at school he gets quite annoyed at himself sometimes, don't you? Although, you know, I think his friends are quite good about it as well.
Yeah. Good friends.
Yeah.
Yeah. Good. Anything else that's upsetting you anywhere in your life?
No.
No. Okay. You're getting on all right in school. Do you work hard and do all right?
Sometimes.
Okay.
No, he's pretty good, I think.
Yeah.
You do get quite anxious sometimes, don't you?
Yeah.
If you are a bit anxious, it's more likely to happen.
Yeah.
So you're obviously, here with your mum, feeling
But
quite
Freddie
calm.
does suffer sometimes, and he did suffer with panic attacks.
Right.
Back in, was it about a year ago or so? And then I spoke to Mind. Is it Mind?
I see.
And we did like a worry box.
Fine. Okay.
So all his worries we used to put in a box.
Yeah. I mean, it's interesting. It's obviously not there the whole time, and it wasn't there always. And that encourages me that actually this isn't going to be a thing that you're going to have
that's what I'm
lasting, ongoing
thinking.
problems with. The thing we do is to ask what we call a speech and language therapist to see you. So they're people who specialise in speech and language, so in the ability to communicate. And they do look at this as a problem. Do we need to do that yet or not? Maybe have a think about that. And if actually you get home and think, well, no, I do want something done about it, I will make that referral. But I also don't want to...
No, maybe we'll leave it for a bit longer then and just see.
Yeah?
See if it calms down.
Do you want me to give you a list of sort of resources you could look up?
Yeah.
Yeah? Patient.co.uk or NHS Choices.
Thank you, Doctor.
Okay, lovely. Very nice to see you.
Yeah, nice to see you. See you later.
Bye, Freddie.
Bye.
Bye.
Nice to see you.
It's been nice meeting you.
You too. Bye-bye.
Bye-bye.
See you later.
Alligator.
In a wild crocodile.
Thank you. That's the plan. Great. Cheers then. Bye.
Thank you so very much for seeing
That's all right. Nice to see you.
Hello, sweetheart. Bye-bye. Enjoy your... Yes, you're gorgeous, aren't you? Bye-bye.
Health Centre, Sally speaking.
My stomach swells up and then the blood just kind of gushes out at me.
I think I'd rather stay alive a little longer.
Yeah, we'd all like to stay alive a bit longer, yeah.
Yes.
I had a bad relationship. I don't trust, to be honest, I don't trust in love.
It's like a burning sensation, like someone's put like a cigarette out in the middle of my ear canal. Okay. And I just don't know what it is. Feels like my eardrums or something's about to just explode or something.
We have to say this because you understand that it's a potential squamous cell cancer.
Yeah.
Too cold. Ugh, nasty. Good morning, Hofford Health Centre. How can I help?
Louise Horton. Hi, Louise. Hello there. Do come on. OK, do come in. All right, I'm Dr. Cordell.
Hello.
You normally see Dr. Lee, don't you? Is that right? Yeah.
Yes. Yeah. I have like really sore skin, just hair on my breast. It looks almost like it's really dry skin. I spoke to someone, like 111 or whatever it is, and they asked if it hurt, and I said, I don't know, because I have no feeling along there after my breast reduction.
OK.
And it's getting bigger, so I'm obviously just a little...
The area of soreness is getting
so I'm a little bit
yeah.
concerned.
Well, we should check it out,
Yes.
shouldn't we? I'll have a look, OK.
OK.
Do you want a nurse to come in while I have a look?
No.
No?
As
OK.
I said to the receptionist,
Pop
once
up
you've...
behind the curtain here, then.
Lovely.
You just remove what you need to remove
OK.
to see the area. And you've not had rashes or sore patches there before?
No, I had a really bad infection after I had my breast reduction.
So, this is the patch?
Yes.
OK.
Hello, come and have a seat. I'm Dr. Barnard.
Hello.
Oh, thanks, Callum.
What can I help you with?
Callum has been going over on his ankles.
Yes.
Now, I thought it'd be something that would probably rectify itself, but last year his school shoes kind of kept on getting wrecked because his ankles were going over, so...
OK, yes.
His teacher at school, kind of at the end of the year, said, oh, I think you should get them checked out.
How long's it been a problem for?
You could start seeing it a couple years ago, couldn't you?
Yeah, it's not something that you would jump up and look at him and go, oh, he's got really bad ankles.
So you're not sort of turning over on your ankle like you're currently twisting it or anything?
Not twisting, it's just literally a posture thing.
Well, I did twist it once and sprained it.
Yeah. And then I kind of noticed that actually everything's turning in a bit, and then he says he's getting pains in his legs, intermittent pains.
Yeah, I was going to ask, you getting any pains in your knees or anything?
Sometimes, yeah.
Yeah, OK. Do you want to pop your shoes and socks off then and we'll have a little look at your feet? OK, and stand up for me. And just go up onto tiptoes for me. Yeah, OK, and back down again. OK, and sit down again for me. It's got very flat feet, haven't you?
Yeah.
Yeah. Does it run in the family at all?
Yeah, we've got hobbit feet.
Yeah.
Well, I've got hobbit feet. I just don't want it to affect him kind of with his running.
So it's really common, flat feet, especially in this age group. We've got quite flexible feet. And generally what you need is insoles in to give you that support to your arch so that you're holding... So you see, when you stand up, because your arch just collapses, your ankle rolls in.
Yeah.
Whereas if you've got the support in there, it comes up to a more natural position and then it's all straight again. So that's what you need. It'll probably be orthotics at the hospital to make some insoles.
So will that, if he has insoles, do you think that will rectify itself, or...?
It doesn't sort of change the underlying foot, but it just puts the foot in a normal position.
OK.
So people with really flat feet will find that they need to wear them all the time and they just put them into their shoes.
OK.
Yeah.
I say that wasn't too bad, was it?
No.
The skin feels a little bit thickened, doesn't it, actually?
And it started off as big as my fingernail, and it's then just got bigger.
It's got
I would
bigger.
say maybe
and
3 weeks.
Yeah, it's a bit bigger than a penny, isn't it?
Yeah.
Now, really, in size. And it's got this sort of little bit off the side. Looks a bit like Australia, doesn't it? Yeah. Dress yourself up. We'll have a chat about what to do about that. OK. Sometimes we take pictures of these funny rashes when we're not sure what they are, but I'll remember yours because it looks so much like Australia.
Well, I've never been there, so it's nice for Australia to come to me.
Yeah, it is, isn't it? OK, come round when you're ready and we'll chat about that. OK. So, first question, is that anything serious or sinister? It doesn't look like it. So I think that's most likely some form of dermatitis, OK?
Oh, OK.
It could just be a type of fungal infection. That's the other possibility.
That sounds beautiful.
Yeah. And if it's not one of those two, we will get a specialist assessment. Now, I think actually we will treat you for a fungal infection first, because if we treat for dermatitis and we're wrong and it's a fungal infection, we can make it worse. So I'm going to give you 2 weeks of antifungal cream.
Okay.
Okay, to use. At the end of that 2 weeks, if it hasn't gone away, I'd like you to go on to a steroid cream, which is what we use for dermatitis. Okay, and do that for 2 weeks.
Okay.
Okay, if at the end of those 2 weeks it hasn't gone away, then we will get advice from a dermatologist, a skin specialist, okay? Yeah. Okay, if we're not winning, it is important that we go on and get a specialist opinion. So, okay?
Yes.
There we go.
Lovely, thank you. Handbag and cardigan. There we go.
You got everything? Jolly good.
Yes, sir. Thank you.
Okay. Bye-bye.
Bye.
And that wasn't the only reason I'm here, Sal. I need your expertise.
I haven't got any of that.
I was going to say, when you find it...
Yeah, exactly. When you find it, let me know yourself, if you could. Because, you know, 58 years, I'm still searching myself.
58? I thought you were older than that.
Cheeky.
Come on in, come and take a seat. How can I help?
Over the last few weeks, I've been in extreme pain. It's unbearable. It's literally, I'm swelling up. I'm still swelling up. A hair, but around here is so painful, and it just was. It feels like I want to stick a knife in to let all the pressure out.
How long has it been going on for?
Quite a while, but over the last couple of weeks, it's got a lot worse. And it's right here and right all around here. The pressure is just so painful.
Okay. Does it disturb your sleep?
Yes, I'm up all night. I can't sleep. I'm just so drained. I'm just so tired. And then when the pain kind of dies down, it's like my stomach starts to pain as well. And then I go to the toilet, and all of a sudden, it's just like gushes of blood comes out.
What's that? What's this? This is a special machine I talk into, and then someone else listens to it and writes up letters for me. It's pretty good.
Dear colleagues, I'd be very grateful if you could see this man in the next few weeks about his problems, full stop.
I've tried to contact you on the phone several times, but unsuccessfully, full stop.
So that she is now a vegetarian, that this was entirely, sorry.
This was entirely, sorry. This was not, I was tested her for it. Full stop.
She's got a raised ALP and an abnormal gamma GT.
I'm writing to you for advice about whether I need to do anything. Many thanks for your help.
Yours sincerely.
Many thanks for seeing her, yours sincerely.
In the meantime, full stop, with thanks and best wishes, yours sincerely.
Blood is not there all the time. It's like my stomach swells up, and it just, when it gets really painful, then I got to go to the toilet, and then the blood just kind of gushes out at me, and then it's like my stomach kind of goes down.
Okay.
And that happens like every couple of days.
Okay. Now, you've had bleeding from the back passage before, and they examined you under...
Yeah, I've had a couple of operations. Well, I think 3 operations now on my bowels. But it's just too much. I just can't cope with it anymore.
So we come up to the couch. I'm just going to have a feel of your tummy. Would you be comfortable with me examining the back passage?
Yeah, fine.
So what I'm going to do is I'm just going to draw the curtain round. If you come and have a lie down here...
Yeah, I'm ready.
All right. Oh. Now, if at any point this is uncomfortable, painful, and you want me to stop, just let me know, OK?
Yeah.
Any pain there?
Yeah, there's always pain there.
OK, that's all done. I'll leave you to get dressed. You let me know. Do you want me to give you a hand in any way?
No, I'll be fine. Thank you.
OK. You all right there?
Yeah, it just takes me out of breath.
There's a couple of things to check out here, Victoria, because it's obviously been going on for a couple of weeks. Now, as opposed to giving you pain relief, I'm actually stopping one of them, which is naproxen. We can book you in for blood tests, and I need a sample of urine. I'm going to have a chat with Dr. Graham about your history, but I think I'll probably be referring you to have a bowel check. Done? Is that OK?
Yeah.
OK.
All right, thank you.
That's all right.
Give me a hand with the door. All right. Take care. Thanks. Bye-bye.
Bye, thank you.
Could you just give me a short description while you
I've got a rash come up all over my back, all up my arms.
Yeah, that's no problem.
Basically, I'm falling apart rapidly.
Yeah, we all.
Well, mine's going quite fast.
Yeah. What, your age?
Yeah.
Let's have a look.
How are you?
Not too good. It's just I got this mad sensation in my ears at the minute.
We've got an 111 report saying that you rang them. Was it yesterday?
It was like last night. Yeah, I went to A&E, but then they just said, I need to see a GP. They said there's nothing really that they could do to help me there.
OK. So did they have a good look in your ear?
I didn't feel like they did really look. She was just kind of just to see if I wasn't dead, kind of, if you know what I mean. Like that's like I do know I've had blocked eustachian tubes before, but now it's starting to hurt where that is, like, and it's like a burning like sensation, like someone's put an ear out, like a cigarette out in the middle of my ear canal.
OK.
And I just don't know what it is.
So when did you start having earache?
Maybe a couple of weeks ago. See, like right under there, like if I could drill in there, that's where the pain is exactly.
Don't.
I know, I'll try not to, like, sore, and I've got like this weird feeling of like rushing wind into my ear. It feels like my eardrums or something's about to just explode or something.
Is that there the whole time, or is that coming in?
That comes in like episodes, like every 2-3 minutes. Like I just get it because obviously nothing's there, so it makes me feel like, whoa, is there something? Yeah. It constantly makes me feel like that all the time, like.
Are you from Northern Ireland?
Yeah, I'm from Belfast.
How long have you been in Bristol then?
Just about 1.5 years now.
What brought you over here then?
Oh, the music scene and stuff like that's like really good, like music.
Pretty cool, isn't it, in Bristol?
And that's why, because I make music.
What kind?
All sorts of stuff, like.
35. Temperature's normal. And have you got headphones on a lot?
No, I don't actually use the headphones a lot, but I am exposed to loud music a lot. Like it's like electronic music, so it can't be like loud music. Yeah.
OK. And I presume you don't wear any ear protection?
Not really, no.
It's definitely would be worth something invested in if you're
definitely
exposed to a lot of loud music regularly, because otherwise you're going to permanently damage your hearing.
Yeah.
And, you know, by the time you're 50, you'll be going, what?
Yeah, that's not good. Like,
to everyone and everything. Right, have a stand up for me a second. Let's have a look. So which ear is it that's painful?
Like both of them, really.
So any pain here?
Not immediately. It's
any pain round here?
No, not that I can feel.
Okay, let's have a look in this one. Okay, so your eardrums actually look really healthy. It's definitely not sort of any nasty infection going on your ears. So I think it is probably your eustachian tubes again.
Yeah.
Okay, have you ever been to see the ENT specialist?
No.
Ear, nose and throat?
No, I have never been referred to them, no.
Okay. Your allocated GP is Dr. Barnard. I can have a chat with her about getting you to see ENT. But the most important thing that you can do is to get some really good ear protection.
Yeah.
So in terms of treatment that you can do now, try some ibuprofen, 2 tablets of ibuprofen 3 times a day for just the next couple of days. That will try and really reduce any inflammation down.
Right.
I'll have a chat with Dr. Barnard.
Right.
Have a look at some ear protection, ibuprofen, and come back if anything changes.
Cheers.
All right, take care.
No problem.
See you later.
Thank you. Cheers.
Between 4:30 and 5:30?
Yeah, I'll be in.
Is that okay? Home number that ends 308?
308.
Yeah, that's fine.
308, I like that's more check stuff, isn't it? Were you an astronaut or something?
No.
Hello. Very efficient this. Well, you trained him well, didn't you?
Come on in, come and take a seat. So I think, Ilaria, your English seemed fine last time, didn't it? Do you feel that we need to get an Italian interpreter? It's okay, isn't it?
Yeah,
really?
I want to try. I need to learn English.
Yeah. So all your blood tests are looking fine. And has this lump that you felt here?
I have a small, but not like last time when I came here.
I'll have another feel now, if that's okay. Is it all right if you just pop your jacket off there?
So I'm just going to have a...
No, it's fine.
I mean, I felt all of this last time, and that whatever it was, I can't feel anything now.
Yeah.
Everything feels totally normal. Yeah, okay. Was there anything else you wanted to ask me today?
I have anxiety. I feel like panic. I'm too emotional. I feel depressed. I don't sleep well. I don't want to take any tablets.
And when did you come here from Italy?
I came in 2015.
Okay. Are you settled in a job here, or are you looking for a job?
I was working, but I look for a new job now. Tomorrow I got the appointment in job center.
Good, okay, so you're looking at the job side of things. Yeah. And how many flatmates or housemates do you live with?
5.
5,
yes.
Okay. And do you have a partner in your life at all or not?
No, I was in a relationship. I had a bad relationship. And, I don't trust, to be honest, I don't trust in love.
Okay, so you're carefree and single at the moment?
Yeah.
And no sort of, with you when you were younger or now, no risk of kind of self-harming?
No.
No, it's more anxiety.
Yeah.
I think you're right that we don't need tablets to help with that kind of thing unless it's something that's so persistent and you can't get out of bed and that you're not functioning.
I think too much. I always...
Yeah, but what might help is perhaps looking into ways of managing the anxiety better or improving the anxiety symptoms, okay?
Okay.
So there's a service here called Bristol Wellbeing Therapies. I'll just give you a leaflet about it. They can talk to you about anxiety, how to manage the symptoms better. Because we all have some traits, don't we? Some of us worry more, others are different. So if you know that and it can help you a little bit, it might be helpful. And how do you feel about that?
Good.
Yeah? And then you're working positively to that. You're going to the job centre tomorrow.
Yeah.
Your blood tests are fine, not worried about your physical health. Okay. And
I always check up about my, a little bit hypochondriac.
Okay, about the health side
because
of
when
things.
my mama, she had cancer, when my granddad, daddy had cancer, I feel more apprehensive.
Yes, worried
So I want to check everything, it's all right.
So I think physically not to worry. If there's any symptoms, you can come back and talk to me or talk to us. Okay.
Okay, thank you very much.
That's
Lovely to speak with you. I like.
No problem. Pleasure. Nice to see you.
Thank you very much.
That's all right. Nice to see you. Take care. Good luck with all the job things tomorrow.
Thank you. Thank you. Lovely. Have a nice day.
Bye-bye.
I still haven't had that chest X-ray.
Right, OK. Hi.
Hello.
Are you partner? Yes.
Not partner.
No,
just a friend.
Just a nosy friend.
Right, are you OK? Are you happy for her to be in here?
Yeah.
Right.
No, she just wanted to tell you about the pain I had last night. I think it was angina attack, and that's what the GT spray's for, isn't it? So I sweated, OK? And it was like a ball in my chest, right, OK? And I took the GT spray.
Yeah.
2 lots and it went.
So, so you've had a heart attack about 2 years ago now, isn't it? So generally, do you get angina pains?
I do get pain,
yeah.
yeah.
And when do you tend to get those pains?
Any time I could be.
So how often are you getting them?
You're getting them a lot, aren't you?
How much is a lot?
You have them...
Yeah, but I don't know whether it's chest infection, because I got a cough at the moment. I'm bringing up green
Okay,
phlegm.
we'll assess that in a second.
Yeah.
So you're getting pains, though?
Yeah,
So how often are you getting these pains? And what are the pains like?
I don't know, it's like a tightness in the chest.
Yeah.
And then I sweat.
Yeah.
And then I take the angina spray and it goes. You know what I mean?
OK, so it sounds like angina then, doesn't it?
Yeah.
If it goes with the spray, I think that's the most
right.
likely.
That's what the surgeons told me at the hospital.
Yeah. Have you been getting them most days since the heart attack?
Yeah, not every day, on and off.
Right.
I get good days, I get bad days.
Yeah. In terms of your angina, I'm a bit concerned about that. Almost daily pains is very frequent, isn't it?
Yeah.
Hello there. That's a good T-shirt.
Thank you. Primark is the way forward, or Primark, however you say it.
I like your T-shirt. It's nice and bright, but
It
sort
is
of
bright.
dark at the same time, isn't it?
Yeah, a bit of sunshine.
Yeah. That looks like a good thick jacket.
Arm inside out.
Nice shirt. I like that.
I haven't seen you before, have I?
No.
So remembered somebody as smartly dressed as you?
I realised when I left the house that I was wearing all blue, and I was a bit worried that it looks like I vote Conservative.
Now, in terms of your chest,
Yeah.
you said you're coughing up green muck.
Yeah.
How long has that been for?
Last few days. Well, because I stopped smoking again.
Yeah.
I've been about 20 days now I haven't had a cigarette for, you know what I mean? So.
Right, let's see what your blood pressure is.
Right.
Okay. No, well, so don't. Don't talk. Okay, it's too high. All right. Let me have a little listen to your chest. Can I pull this up at the back?
Yeah.
Okay. Deep breaths. Okay, a bit wheezy, not too bad. Okay, let's get a chest x-ray. I'll request it again, but go up this time.
I've got it tomorrow.
You're going to nag him. Excellent. OK. Now, we need to add in something for your blood pressure.
Oh, is it all right?
So you're on amlodipine.
Mm-hmm.
So we need to add in ramipril. So go for a chest x-ray tomorrow.
Yeah.
Start this new tablet, 1 a day for a week, then 2 a day. OK?
Cool, yeah.
Book an appointment with the nurses for a COPD review as well.
Yeah.
OK?
OK, yeah. Yeah, cool.
And then we'll try and start to sort everything out.
Remember when, before I never had a movement in my foot? So I bought one of these circulation boosters, right, okay? And
No idea what that is.
No?
So in
Well,
which
it's a thing
case I
you sit
don't...
on, and
Yeah.
look, I can move my foot, and I moved it for 2 years.
Brilliant.
Oh, yeah, I bet you're excited about that anyway. Yeah, time to go, sharp exit, quick out.
Right, so book an appointment for 2 weeks, yeah?
Cool, all right, thank you.
OK, bye-bye.
Thanks.
Bye-bye.
Hello, can I help?
Yes, please. I think I've got an appointment for the treatment room.
And the name?
Guy.
No, you've got an appointment on Friday at 9 o'clock. You're diabetic with you on Friday, my lovely, yeah. All right.
It's all right. Well, I'd written it on the calendar as Monday.
Right.
Had a text
No,
reminder.
usually text the day before, so hopefully you'll get the text Thursday. Yes, Friday at 9.
Thank you.
All right, no problem. We'll see you then. Take care, bye-bye.
Gaynor Pocock, please. All right?
Yeah. Not really.
Well, you wouldn't be here. It's one of those stupid questions, isn't it? Those doctors. I've probably been saying it for the last 20 years.
No, fine, thanks.
OK, I'm Dr. Bolam.
Yep.
What can we do for you?
Well, going back last year, I had a growth on my leg. And I feel, or I think, I got another one coming.
So last year, did you have it removed?
Yeah, I did.
And what was it?
Some sort of carcinoma, was it? Something
It
like
was
that.
a cancer, was it?
I think so, yeah.
OK, shall I have a little look?
Yes.
Seeing as do you think it's the same thing, do you?
Well, I can remember this is how it started.
A squamous cell cancer. OK, let's have a look. So the previous one was here.
It's near enough sort of opposite, really.
Right, they did quite a wide excision, didn't
Yeah,
they?
yeah.
Yeah, OK. So tell me about this then. How long's that been going
This
on?
one's about a month.
What's it doing? Is it bleeding or anything?
No, not bleeding, but I just know it's there.
You know it's there.
And it's raised more in the last, that's why I've come.
OK, it
started to raise, that's how the other one started.
OK, so it's pretty much the same as the other one, is it?
Yeah.
OK, all right. Yeah, and do you protect yourself from the sun?
Yeah.
OK, all right, I'll refer you back. Was it similar size, the one that was removed?
That's how it started, but by the time I got there, it was like about this, come out about this big.
OK.
And they didn't ask me for a follow-up or anything, or told me. They just said, if you get anything, just go straight back and get straight back up here.
I'll do the urgent referral, all right, because we like to get rid of those. If it's the same thing, we do like to get rid of those quickly, OK? Yeah. So that means you will get an appointment in the next 14 days. And you understand that, obviously, we have to say this because I have to tick a box. You understand that it's a potential squamous cell cancer again. You understand that?
Yeah.
OK. All right, so
This just tells you about the urgent referral scheme, tells you what to do if you don't hear from anybody in a few days' time. All right?
Yeah.
Give that number a ring. OK?
Yeah.
Is that all right?
Yeah, that's fine.
OK?
That's lovely.
All right.
Yeah. I'm just glad I come and got it rolling.
Absolutely, yeah, absolutely. OK.
Yeah, thanks
All
very
right
much
then.
then.
Okay.
Thank you.
No worries. Bye-bye.
Okay, Jacqueline, can we grab a seat? Are you in trouble?
What?
Are you in trouble?
No,
It's only two. It's to do with your back again, I think.
No, this is to do with the cancer bit.
Oh, right, OK.
My brother's had gene therapy.
OK.
So they've sent letters out to the family just so I can get an appointment. They said they'd send it to you.
Right, OK. Let me have a look at this, because this is not what I thought you were coming back about your back.
No, touch wood, it's fine.
Oh, good,
really,
oh, good. All right.
I can't be more happy with it. It's like I'm young again.
OK, and you have mentioned the business with cancer before to me,
Yes,
haven't you?
yes.
Family history of bowel cancer. This is your brother, you say?
Yes, and my mum's had it as well.
I presume you've come here with the letter. You'd like to have this.
I certainly would, yeah, definitely,
yeah. Yeah, OK. Genetic testing is used to find out if someone is carrying a gene that might predispose to a particular condition. People are counselled before any form of genetic test is carried out. It is very important that people understand the potential benefits of testing, such as early diagnosis and possibly even cure of a condition that otherwise would be very serious. But they also need to realise that there are risks associated with testing, particularly the anxiety as you go through the test, and also if something is found of a serious nature. Have you thought through all the implications of what it would mean if it was positive? Or
Yeah.
Tell me what you would do if it was positive.
Well, just do what the doctors say, really. It's down to them, innit? I'm not sort of one of those who gets fazed with anything.
Okay.
It's just...
OK.
Because I've had a scan with the camera up there, and that was all clear.
OK. So, but if it was positive, I think there'll be three implications. One, I think, is that they would want to continue to give you scopes quite frequently.
That's fine.
Yeah, OK. Secondly, I suppose, in theory, that there might be an implication in terms of sort of insurance in the future. So, you know, if they knew that you were an increased risk of a particular condition, that the insurance companies might take a view on it. The third thing is, I suppose, there would be implications for children as well. You got kids?
Yes, I've got two, yes.
Yeah, so, I mean, if you had a positive test...
Yeah, that's what my brother explained a lot of this as well.
Then they would have the decision to make that you've had to make, and you know, that would be putting that on.
But I think I'd rather
down to them, and so they
stay alive a little longer.
Yeah.
Then sort of say,
sure
forget it. Like,
we'd all like to stay alive a bit longer.
Yeah, definitely.
OK. All right, so I'll make a referral to genetics service. OK, and you'll get the letter through the post.
Excellent. Thank you very much.
All right, OK.
Thanks.
Cheers.
Just with somebody can you hold. Carol?
Let's wait.
Let's wait. There you go, Carol. Take care. Bye. Hello. Sorry, my lovely. Can you hear everything? I put it on hold. I put it on hold. When I put it on hold the other day, it played music for me. There's obviously something wrong with this blooming phone. Yes.
So, what's happening today?
You tell me.
I saw you about 3 or 4 weeks ago, yeah?
Yeah.
And the main problem is your knee at the moment.
It's my hands as well.
And your hands as well. You were trying out a little bit of having some morphine.
Yeah, it helps, but it don't take it away.
No. And apart from that, what are you taking painkiller-wise?
I've got these patches on.
Yes.
Naproxen.
Yeah.
And then...
and paracetamol.
Yeah, and the other one's on a night...
Amitriptyline.
You're rattling soon.
Yeah, you are on quite a lot.
I got it in this side of the hip as well.
Yeah.
And my shoulder.
Yeah.
Because I think you seen my missus last week.
Yes.
And I tried to do everything for her, but I just can't do it.
Yeah.
In the mornings, it's like, can't move them.
Yeah. Which bits of your hands are affected? Do you want to just show me?
Yeah, it's all in the knuckles.
Right, in these ones here?
Yeah.
OK.
And it's the same with this one. I think
OK.
it's swollen this morning.
Yeah. If I press, say, on that joint there, does that hurt?
Yeah, a little bit, yeah.
It does. And this one here?
Yeah, they're tender.
Yeah? OK. And did anybody do any blood tests to see if you had an inflammatory arthritis, something like rheumatoid or...
He said it was osteo.
Osteo.
Yeah.
Yeah. So I am wondering whether we should maybe repeat those bloods and maybe even get you seen by a rheumatologist, just to be sure that we're not missing something.
I only think that'll get rid of it. Or ease it off.
And do you think you need a bit more help at home with your wife?
I've got a granddaughter, but she's at college.
Yes.
Because Heather, when she stands up and sits down, that's it. She can't do nothing.
No.
And I can't get in the bath now because of my knees.
Yes.
So we've put in for a walk-in bath or a shower or something.
Good. That sounds like a good idea.
I haven't had a bath for, I can't remember.
Yeah.
I got in there one day, I couldn't get out.
Right. OK.
So I just have sort of strict washes now.
Yes. And how are you feeling about your caring responsibility? Is it getting you down a bit, do you think?
Yeah, because I worried about Heather, because she nearly died last year. Yeah, I just...
So I think we ought to put you on our carer register, I think, shouldn't we? Yeah, because you definitely are her carer. If you weren't able to do what you are doing, then somebody else would need to. And it may be that it is time to think about whether you need some more help at home. So the way to get it in Bristol is through an organisation called Care Direct.
Yeah.
And we have a carer coordinator at the practice called Heather. She can contact you and see if there's anything else we can help with. Would that be all right?
Yeah, that'd be great.
Yeah. And I'd like to book you in for another set of blood. Is that all right?
Yeah.
Okay.
Yeah, well, falling apart. Works on me like an end up dead.
I'll see you again, OK?
Yeah, thanks.
Bye-bye.
Bye.
Stephen McDade? Hi, come and have a seat. What can I help you with?
My partner required that I came.
Yeah.
We were out on Saturday.
Yes.
And Foot Park, and I fainted.
Right.
And she's a nurse.
Yes.
And she was pretty much after that, taking my pulse the whole day. And she kept telling me I had an irregular heartbeat.
Right. So take me back. Exactly what happened with the faint?
To be honest, I hadn't drank anything all day.
Yes.
And we were on our 5th ride.
Yeah.
And I came off and I could hardly walk.
Yes.
And I just fainted.
And did you start? So you started feeling unwell.
Yeah.
Did your vision change at all?
Yes.
What was it doing?
Kind of blurry.
And then you just
fainted.
Fainted. And do you know how long for?
A few minutes, I think.
And then other people were around you, were
Yes,
they?
yeah.
Did they notice you shaking or anything like that?
My partner did, yeah. She said that I was shaking and I just went to the floor.
OK, before you went to the floor?
Yes.
Yeah, but you didn't think it looked like a seizure?
No.
No. And then when you came round, how did you feel?
Very shaky, sweaty.
Yeah.
And eventually, after a while, I was actually sick as well.
OK.
I found out Saturday that there is history of heart problems, and like my dad's got low blood pressure, my mum's got high blood pressure.
Right.
And my granddad died of a heart attack.
And you look much better.
Yeah,
let's face it.
I do.
Yeah, your nails are done, your makeup's done. All right?
Yeah.
That's a good noise, isn't it? Thank you for wearing shorts. Nice, easy knee examination.
I just want to check if there is Dr. Graham running late. She said, I'm not even going to bother to check. She never runs late.
That's not actually entirely true. So if you find you feel a bit weird on it, then you just have to take it off.
They are. If I go weird, you know why.
Any weirder?
Oh, thanks, Doc. Yeah.
OK, boys, it's time to go. Sorry.
He's got a rash on his back and it's not seeming to go down, so I just thought I should just get it checked out.
Oh, yeah.
It's really only on his back, like there's an odd one.
You've got one or two, haven't
Yeah.
you? OK, you can put your T-shirt back down and have a seat now. How long's it been there?
Well, probably since, like, Saturday evening.
Maybe, yeah.
So not very long at all.
Because I went to the woods on Thursday with cubs, and I came back and I felt fine. And then on Saturday, my back started itching, and they had a look and they saw a rash, and then on Sunday it got a bit bigger, hadn't it?
And is it itchy?
Yeah.
It is.
When sometimes I can just feel it itching, I try not to itch it, but
Very good.
sometimes it's just itching so much that I just can't resist it.
Fair enough, that's very honest. And do you feel ill in any way?
No, I don't really
No.
feel ill, it just...
Okay, well, I think what we'll do is we'll just take your temperature and your pulse, okay? See what that shows. I don't think it's anything too worrying, okay?
Okay.
That's totally normal. Let's take your pulse. Just have a wrist. That one will do. That's fine. Okay, and have you looked it up and thought about what it might be?
I gave an Imperaton to take the itching away, and then I just did look up chicken pox.
Yeah.
Because he hasn't had that.
Right.
Piriton, it helped a little bit.
Well, it's great stuff for stopping itch of any type, okay? So I think that it is possible that something in the wood irritated your back, okay? And that you're a little bit allergic to it, and so you've got this rash. It looks a little bit like nettle sting, and it's behaving a bit like that. So you're not ill in yourself, but it is a bit itchy, and that's about it, really. It's there.
I did see some stinging nettles.
I'm not saying that it's caused by stinging nettles, I'm just saying it's a bit like a stinging nettle rash. And it's probably due to an allergy that isn't anything to do with stinging nettles, it's just something that was in the wood. You're doing the right thing by giving the Piriton, which is giving him some relief from the itch.
Yeah.
And that's probably all that needs to happen.
Carry on with the Piriton then?
Yeah.
Okay.
Yeah. Is that all
Brilliant.
right? Yeah.
Thank you.
Good. Okay.
All right, thanks.
Thank you. Great.
Okay.
Thank you.
Can I have a little listen to your heart if you lift your top up for me? Okay. Just check your pulse. Just follow my finger with your eyes. Not seeing double at any point. And you felt completely well since Saturday?
Yeah.
Yeah, okay. And do you drive at all?
Yes, I do.
Yeah. So I need to look up the DVLA guidance for what we need to do.
Am I going to lose my licence?
I don't think you're going to lose it, but you might be temporarily not able to drive while we do some tests.
Okay.
It sounds very much just like a simple faint.
Mm.
It's just now this kind of thing about your partner reporting that you had this irregular pulse. That's the kind of complicating factor. So I think you must not drive for the time being until we've done the tests. Does that sound annoying?
Yeah.
Yes. OK, so tests will mean some blood tests, an ECG, and then what you really need is a monitor you wear for kind of 24 hours that will pick up any irregular heart rhythms and things. So till we've got all those results back, no driving for the time being.
I can drive home?
Would be no. You'd have to get someone to come and pick your car up for you.
Okay. Give my dad a call, because we only live up the road anyway, so...
That's fine. OK then, and we'll take him in there. And if you have any more episodes, we need to know about it.
Okay.
OK.
No problem. Thank you.
Bye.
Hello, look at her.
Not from me, it's from the uncle.
Can't got an uncle.
Bring you my wee.
Oh, thank you. I love it when patients bring me wee. OK. Why have you brought me wee?
I had a urine infection. I get them semi-regularly, so I know what the symptoms are. I got it Sunday mid-afternoon, actually, probably.
Yeah, that's very specific.
So I basically spent the rest of the afternoon backwards and forwards from the bedroom and bathroom.
Urgency?
Yeah, I need to go right now or I'm going to wet myself.
Yeah. Pain?
The first bit of wee is fine.
Yeah.
And then it's the very last, dribble, stings, and then my body feels like it's squeezing like a sponge, got the very last bit out.
OK.
And then I release, and then I'm like,
OK.
Isn't this feeling amazing for about a minute? And then I'm like, oh my God, really need to go for a wee.
Go again. OK. Any tummy pain at any point?
I've had some tummy pain kind of here.
Anything high up round your back?
No.
Any blood at all that you've seen?
When I wiped, it was slightly pink.
Okay. Okay, yeah, so yeah, you've got a urine infection, definitely. So we'll give you some antibiotics.
I'm allergic to penicillin.
Won't give you that. But no other allergies apart from...
Plasters, wool. I'm allergic to a lot of...
Wool?
Wool makes me come up in a rash. Some shampoos make me...
It's the ginger gene.
It is.
I'm a closet ginger as well, and I had a bit of a reaction to, what was it, fentanyl after an anaesthetic, and the anaesthetist said, oh, it's because you're fair and ginger. Apparently it's a really common thing to have sensitivities. The most common cause of urine infections is sex. Yeah, so always empty your bladder after sex, and then just the obvious other things like wiping front to back, which I don't know who doesn't, so... And just making sure that you're drinking plenty as well. Just have a quick feel of your tummy, just have a lie down on the bed for me. Right, just check that you've not got any nasty pain anywhere.
That does feel quite uncomfortable.
There. Okay, that's all right.
Yeah, that's...
There, okay. That's all right. Okay, all right, so just lower down. This is over your bladder, so that's fine. Right, I just need to get a signature for this.
Yeah.
If you have a seat back in the waiting room, and I'll bring this out to you when I've done it in a minute.
That's wonderful. Thank you.
All right.
Bye.
See you in a sec.
Do you feel any better now?
Yes, I do feel a bit more relieved.
Nice to see you both.
Thank you.
Bye now.
Bye, Carla. Nice weekend.
See you next week.
See you next time.
Thanks for your patience.
That's what I am, a patient.
Yes.
Okay, bye-bye then. Bye, Dumbo.